Hello, can we all hear me? Okay. Good evening, everyone. Welcome to class. Thank you so much for joining. For those who are on the session, we expect to have more mentees joining soon enough. So we'll be starting. Welcome to week 3 of our GIIPCC Mentorship and Internship Program. And so far, we are going to be having a combined session. In today's class, we're going to be having a combined session that will be treating medical healthcare fraud and patients' rights, and also emerging healthcare issues in emerging healthcare. Yes. So without wasting any time, our mentor for today in today's session is going to be Mr. Ebenezer. Right. Mr. Ebenezer is a legal practitioner, medical law consultant, certified mediator, a trained legislative drafter, and a passionate patients' rights and safety advocate. He is the principal partner, Law Founds Multidisciplinary Consults, a firm that provides innovative legal solutions located in Abuja, Federal Capital Territory, Nigeria. He is he is also the founder and executive director of Lawyers Arise for the People Initiatives, a patients' rights and safety advocacy NGO. Ebenezer is a trained medical care assessor by the International Medical Law Center, St. Kitts, North America. He is a member of the Nigerian Bar Association, member Medical Law Professionals Association of Nigeria, member Institute of Medical and Health Law, member Bioethics Society of Nigeria, member Patient Safety Africa, member World Association for Medical Law, and member Association of Legislative Drafters and Advocacy Practitioners. He currently serves as the chairman, Health and Medical Law Committee, Nigerian Bar Association, Gariki Branch, Abuja, the Public Relations Officer, Institute of Medical and Health Law, and the legal team lead for Make Our Hospitals Work campaign, a citizen-led, community-based advocacy to improve the quality of healthcare services in hospitals and primary healthcare facilities across Nigeria. He trains doctors, nurses, and healthcare professionals on promoting patients' rights and avoiding medical negligence. He is an avid reader, a researcher, and loves to serve God by serving humanity. Thank you so much, Mr. Ebenezer, for joining us. We are happy to have you in class. So we'll not be wasting any time and we'll be getting straight into the business of today. In today's session, we'll be having, like we earlier mentioned, we'll be having two sessions mixed in one. And we will start off by we will start off by taking the presentations from the previous class. That is the presentations from the healthcare fraud and abuse class. So please, the group presenter for group 1, please, you can go ahead, start the presentation on healthcare fraud for your group. Then we'll have group 2's presentation, and then we'll have Mr. Ebenezer's presentation, and then we'll move over to this week's topics presentation. So is the group presenter for group 1 in class? One presenter. Bukola, are you with us?
Hello, group 1. Who is presenting for you? Who are in group 1 here?
Okay, Bukola, are you with us? Can you hear?
Who then is from your record? Who is supposed to present for group 1? Hello, Dennis. Who is supposed to present for group 1?
Do we have the presenter for group 1 in class? Bukola, are you with us?
Can you hear me, Dennis? Can you hear me?
Okay, not to waste any time. I don't know. I'll try to reach out to her personally. Can we have group 2's presenter come up and make presentation while we try to get group 1's presentation up?
Hello, Dennis. Can you hear me? Hello, can anyone hear me at all? Anybody?
We can hear you, sir.
We can hear
Okay.
you, sir.
You see, this is exactly what brought us to where we are today, and we're having backlog of lecture. Who and who are in group 1?
So I'm in group
Is
1.
any member of group 1 here? Anybody, just raise your hand. Identify yourself if you are in group 1. Dennis,
Hello, sir. I can hear you, sir.
is everybody here in group 2?
No, not everybody. We have some
Raise
group
your
members.
e-hand. If you are in group 1, raise your e-hand, not on the chat box. If you're on group 1, raise your e-hand. Gospel says I am in group 1. Okay, who apart from Gospel, who else is in group 1? Dennis, from your record, apart from Gospel, who else is in group 1?
We have Isa, Ismaila.
Isa, why are you not raising your hand? Just, Dennis, give me the names of the people in group 1 here.
Okay. All right, so let me do that. So I'll send it to the main group.
Yes.
We have, I think we just have 2 members of the one in class here. That's Isa, Miat, and Godswill Karen.
Okay, so should we conclude that members of group 1 are not ready for this class? Because this is the 3rd consecutive week. This is the 3rd time consecutively that group 1 is holding the class to ransom. So maybe what we are going to do is incorporate Asa and what's his name, and Godswill to group 2, and then you cancel out group 1.
Okay,
do you understand me? Yes, so that we can make progress. We cannot come to class every day and group 1 will hold us to ransom when we have a lot to do. So maybe you cancel out group 1, and going forward, the 12 students, is every member of group 2 here?
Yes, group 2 members are here.
Is every
group 2
member,
members
not
here.
members. How many are you in group 2? Apart from Dennis, any group 2 person should tell me your number.
I'm here. I don't know about the rest.
How many are you in group 2? This is a group. You should know your number. I understand that this is an online class. You all are not physically together in one place. So, but as a group, particularly where you have a group assignment, I expect you people to have your own WhatsApp platform as a group. Do you have such?
Yes, I do.
Yes, sir.
Yes. Who is speaking, please?
So we are 9 members in group 2.
Okay, good. Are the 9 of you here?
I think I see myself and Omozusi.
We are
I'm in group 2.
I'm seeing 13 names here on the platform. So 2 people from group 1. Okay, so Dennis, let's make progress. Group 2, have your presentation, but scrap group 1. The 2 people that are here, what's his name? Isa and Godswill, put them in group 2. So we know we have only one group and we make progress.
All right, sir. No problem, sir.
You people may not, you might see my decision as harsh or inconsiderate or wicked, but you have no idea what it takes to. You people are the ones who want to learn. Is it because the class is free, you are not paying for it? Now, my anger is that the 3 cases we have had is group 1, group 1, group 1. This is the 3rd time it's happening. So for me, it does not show sign of seriousness on their part. Of course, I know that some people are serious in that group. On the other hand, I said, make the presentation flexible such that it does not rest on the shoulder of one person. Because even if the person is serious and on that day the person falls ill, there is nothing we can do about it. The person is sick and it is out of the person's control. So if you have a situation where 2, 3 people, ordinarily should be anybody in the group can make the presentation. So it keeps all of you on your toe. I think that's what I will do going forward. Dennis, from next week, when we gather, I will pick who we present for each group. So all of you go and study when you prepare your material, study it. Dennis, do you understand me? Each group, don't pick any presenter. Study prepare your material, come for class. When we gather, if I call your name on your group, you start your presentation. That way, every member of the group would familiarize himself or herself with the material. As at Friday, your material was submitted to me, so we have conquered lateness in submission. Next is now having presenters available. So we will conquer it by this week we are entering. The next class, all the group members be ready. Once we come, if I call your name, you start presentation for your group. So let me have your presentation, group 2.
Okay, so please do this presentation for week 2, that is for healthcare program. So please, presenter, you can go ahead and write.
All right, good evening, everybody. My name is Helen Tarinabu, and I'll be presenting on the topic.
You presented last week.
Yes, sir.
So you cannot present again today. Let's know. You cannot present again today. Dennis, this is a training. I told you, structure the presentation such that by the time we are done with the program, everybody would have had opportunity to present at least one. Last week,
yes, sir. Presentation
for group 1, for group 2. So she cannot be the one presenting again. Group 2, give me another presenter.
Hello, sir. She's supposed to retake the presentation from last week. That's what we are currently doing. We'll be taking last week's presentation.
Okay.
We're not,
okay.
Yes.
Okay. Sorry about that. Let's progress.
Okay, so I will be presenting on topic we treated last week: understanding medical malpractice, the causes, the trends, and prevention of medical malpractice. From the last class, the lecturer made mention of we using medical negligence and medical malpractice interchangeably, and that they actually, both terms have different meaning. Both terms apply in different cases. So I would first of all want to state the difference before going on to the presentation. So for medical negligence, it is a broad term that refers to the failure to meet the standard of care. And medical negligence can arise from either the healthcare provider or the patients in question. Then,
Prosper.
My goodness. So medical negligence is where the healthcare provider's action or omissions falls below the acceptable standard of care for similar, and also the patient as well act in a way or fails to act in a way that causes negligence because of. So, having said that,
Can you increase your
it's
voice,
important to
please?
know that medical negligence is often unintentional and it results from.
Hello, Tari, can you increase your voice? Can you be more audible?
Sorry, me. I said it's important to note that medical negligence is often unintentional and okay. I said it is important to note that medical negligence is often unintentional and then it results from carelessness or a mistake or an oversight. And oftentimes as well, it doesn't lead to it doesn't lead to injuries. A specific type of a specific type of negligence that results to injury or harm to the patient. Now, it often stems from the healthcare provider going or failing to meet the standard of care prescribed by their profession. So that is where medical malpractice from. And then it involves a higher degree of recklessness or negligence from the medical health care provider. Now, it requires practice. The patient will have to show that he or she suffered injury or harm arising from the omission or straight into the topic for today: medical malpractice, trends, the causes, and the prevention. I said earlier, medical malpractice occurs when a healthcare professional fails to meet accepted standard of care to harm on the patient. Some examples of this medical malpractice include misdiagnosis or misdiagnose a patient of a patient that normally will be diagnosed with having a heart attack and deduct his diagnosis of acid reflux. So it leading to a fatal consequence on the patient. That's an example of medical malpractice, which is diagnosis or delayed diagnosis. Another example of medical malpractice is surgical error. So you have a healthcare provider, maybe as a result of wrong labeling, gets to amputate the wrong leg of a patient, leading to harm or injury. Then we have medication errors where the medical provider prescribes the wrong medication to the patient or administers patients. Another example of medical malpractice is birth injuries. So, for instance, where there's a delay, in the health provider attending to patient about to deliver, and then that delay causes the child upon the delivery practice. Then we also have anesthesia errors. So we have Another example is lack of informed consent. So here, the patient would, rather than what's the right word now? Well, give the patient an alternative or, or present two or two options to the patient to be the one to decide on whatever option is suitable for him, with respect to the children's ailment. So that is, those are the examples of medical malpractices. So I want to include this as an example of medical malpractice where we have is supposed to have been discharged, but the double bills, and then you now end up infringing on the right of the patient, like constraining the patient that bed space, and preventing him from leaving due to failure of obligations and all that. So right into what the causes of medical malpractices are. So there are several factors that lead to medical malpractice. We have human error, we have poor communication between themselves or the healthcare providers and the patient, that will end up resulting to incorrect treatments. We have inadequate training experience or insufficient knowledge on the part of the healthcare providers. The hospital is understaffed. They have poor record keeping, or the hospital is overcrowded. These are examples of systemic failures. And we have technological errors, faults, where in the use of technological appliances to carry out a medical treatment or diagnosis, and then an error occurs, and and so forth. So these full malpractice. Now, the effect of medical malpractice patients, like from physical to emotional damage to serious financial hardship, and it's only disabled or lose the quality of their life, or so many things that in the long run, what the malpractice of the healthcare provider has on a patient is that it causes severe discuss trends. You would talk about the fact that, okay, so that's the effect. Let's just go straight to the trends in medical malpractice. One of the trends in medical malpractice is the increase in, we talk about children's medical malpractice, we're talking about those patterns that evolve over time, and the characteristics of those patterns, those characteristics. So, like I said, one of it is the increase in malpractice lawsuits. We have of their rights, and we want to enforce that right. So, eco malpractice, and I was about saying earlier that when a lawsuit is instituted against the healthcare provider, either as the
Sorry, please. Can anybody hear
organization
Tari
and
clearly?
individual, for that lawsuit
Wait,
to
please.
fly, or for you to have a case in court, you must establish that there has been injury or damage. That is when it can actually sue for. Or another trend in medical malpractice is the growth of telemedicine malpractice, where we have diagnosis due to the lack of physical examination. Sorry, pardon?
I was asking, can anybody, is everybody hearing her
Am I
well?
heard?
Your line, what
Your
you just said now came out very clearly, but your presentation is stuttering at my end. I don't know whether it's a
It's the
peculiar
same,
challenge. Hello?
it's the same
um,
thing here.
Okay. Because I was wondering that we might be losing what you're saying. So is it a network problem? Can you relocate? Can you change where you are?
Okay, I'll just switch the network I'm using and then.
Participants, anytime you don't hear anybody, including myself, raise it, because you are here to learn. If the person continues speaking and you do not hear, you'll be wasting our time, and more importantly, your own time, because you are not gaining anything if you can't hear the person speaking. So at any point anybody is speaking and you can't hear, either you unmute to raise it quietly, or you just type it on the platform that you cannot hear the person, so that correction, amendments will be made towards that. Thank you.
okay, Tari, please, you can carry on with your presentation if you are back with us.
Yeah, you can carry on. Just change your position, because it's my
Okay, so
network.
yes, yes, I have. Okay, I've switched over to a different network. I hope I am audible now.
You are, but it's breaking a bit.
Can you hear me? Can anyone hear me?
Yeah, we can
Yes.
hear you.
Right. So I was talking on the trend in medical malpractice, and I said that we have an increase in malpractice lawsuits, and I made mention of the fact that patients have now become aware of their rights and are more likely to file suits against the healthcare provider when they are harmed. And I said that one of the major thing, right, to when filing a suit, the major thing to show before damages can be awarded to such a patient is that he or she has suffered injury or damage as a result of the malpractice from the healthcare provider. Now, I went further to say that another trend in medical malpractice is the growth of telemedicine malpractice. So, since we do not have a physical, due to the rise in technology and everybody adopting technology, so there's no opportunity to have physical examinations. We have different apps arising from everywhere. You just go have virtual consultation sometimes, and then this consultation might lead to misdiagnosis again, which is a cause of medical malpractice, and thereby leading to, if the patient seeks to further seek redress, it leads to another lawsuit for malpractice. So we have high malpractice payouts. So here, the awards and settlements have increased, particularly in cases that involve permanent injury. So that's another reason why we have um, lawsuits again in malpractice lawsuits. So people, the courts now tends to award, high settlements for those that have suffered a permanent injury or those that have suffered death where malpractice has occurred from the healthcare provider. Then we have defensive medicine practice. Here, malpractice, doctors often order unnecessary tests or treatments just to avoid lawsuits. So what's happened here is where the acts or the omission has been done that would lead to malpractice, the doctor often get order.
Hello, are you still with us?
Yeah. At the point my network went off. Am I heard now?
Oh, okay. Yeah, we can hear you. Please continue.
Yes. So we also have rising insurance costs for doctors. So malpractice insurance premium have also increased, especially for high-risk medical field like surgeries and obstetrics. This is another trend in medical malpractice. The doctors get to take insurances to cover up, situations where there is a case of medical malpractice, especially in the field of surgery and obstetrics. So onto the prevention of medical malpractice, the ways in which the healthcare field can prevent medical malpractice includes improved communication. So there should be a clear communication between the healthcare professionals and the patient, between the healthcare professionals, amongst the healthcare professionals, and then there should be reduced misunderstanding. There should be a structure of procedure so as to improve patient safety. Another way to prevent medical malpractice is in law, we have what is called continuous legal education. So in the medical field, there should be continuous training to ensure healthcare providers stay up to date on the best practices, as well as the use of technology. I know I said earlier that with the rise in technology, we can also have a misdiagnosis and technological failure that could lead to medical malpractice. But also where we have these technologies too can also help prevent this malpractice. For instance, where we have electronic health records, this would help prevent misinformation again. It will help create a structural platform of organizing the patient's record. It will help prevent medication errors, and then, like I said, improve patient tracking. Artificial intelligence can also help in diagnosing some conditions accurately, though not 100%, but AI could also assist in the right diagnosis. Now, another measure to prevent medical malpractice is strengthening the informed consent. So the healthcare practitioners are expected to explain fully well to the patient, to their understanding, what their treatment involves, and if there are other options, so that the patient will be adequately informed as to what is the best decision to be taken for their ailments, so as to reduce the risk of medical malpractice or dispute. Another way to prevent, sorry, did you say something? Another way to prevent medical malpractice is better staffing, workload management. The hospital should manage their workload and prevent, exhaustion on their staff. I don't know if I remembered vividly. I think the first class, the lecturer talked of the ratio of a doctor to a patient. So the hospital should ensure that their staffs are not burned out. They have enough staff for enough doctors for the patients that are available. Then the healthcare sector should implement standardized protocols. So follow the laid down guidelines or regulations available in the healthcare sector to avoid likelihood of mistakes. In conclusion, medical malpractice remains a serious issue, but proactive measures can reduce its occurrence. Improving communication, leveraging on technology, ensuring proper training, healthcare providers can enhance their patient safety and avoid legal consequences. That will be all for our presentation. Thank you.
All right, thank you for your presentation, Sari. Do we have Group 1's presenter in class so that we can take presentation on healthcare fraud and abuse, and then we can have the discourse, and then we'll move over to week 3 topics. Sorry. Do we have the group presenter for Group 1?
Yes, I'm here.
All right. All right, Chris, you're welcome. Please, can you kindly go ahead and start the presentation while I try and share your slides?
Okay, sir. So I'm the presenter for Group 1, and the topic for the presentation is healthcare fraud and abuse detection technique.
All right, please go ahead.
Okay, I'll start by reading the table of contents, which includes the introduction, the meaning of healthcare fraud and abuse, the parties involved in medical fraud and abuse, healthcare fraud detection technique. I'll also be speaking on regulatory law agencies for the regulation of fraud and abuse in Nigeria. And then the conclusion, the recommendation before the conclusion. So first of all, I'll start with the introduction. Healthcare fraud and abuse represent significant global challenges in healthcare system, resulting in financial losses estimated at 3% to 15% of total healthcare expenditures actually. So we'll be moving to the meaning of healthcare fraud and abuse. First of all, I'll be defining the term fraud. Fraud means any intentional deception or misrepresentation to obtain an illegal benefit or to cause harm. And then what is abuse? Abuse refers to actions that are inconsistent with acceptable business or medical practices, potentially resulting in financial or ethical misconduct. In another perspective, abuse refers to practices that are directly or indirectly leading to unnecessary medical costs. And so we may want to ask, who are the parties involved in healthcare fraud and abuse? Basically, healthcare fraud and abuse involves 3 parties. That's the healthcare service providers, that is the physicians, the pharmacies, the health centers, pharmacies, or ambulance companies, which render healthcare services. And then we have the healthcare service consumer, or the beneficiaries, or insurance subscribers, that is the patient, which receive healthcare services from the provider. And then the healthcare insurance carriers in the health insurance sectors. which collect steady premiums from subscriber and make the commitment to pay healthcare costs. And so we move to slide 4. I mean 5. That's examples of healthcare fraud and abuse. They include but are not limited to the following. Number 1, billing for services not provided or for services that are not medically necessary. 2, kickbacks or bribes for referrals. 3, ghost patient. 4, identity fraud. So I'll be briefly explaining the 4 examples. Number 1, billing for services not provided or for services that are not medically necessary. Claims are generated and submitted to insurance companies for healthcare services that are not provided. So for instance, maybe the healthcare service provider, maybe the doctor may provide that he treated a patient, and then after maybe checking, they'll discover that that patient was not actually treated for that particular maybe result that was brought. And then kickbacks or bribes for referrals. One of the widespread and discussed form of healthcare fraud is kickbacks. These occur in many forms. For instance, pharmacists can fill a prescription with a specific brand of drugs instead of the order that sees it from the pharmaceutical company. Aside financial implications, these drugs might also be harmful to the patient's health. So let's just take, for instance, you go to the pharmacy and then he refers a drug to you, and then he knows that if you go to another place, you get the drug at a cheaper rate, but then he'll refer a particular brand to you, probably because maybe this brand reached out to him for referrals. And so that is an example of healthcare fraud. And then number 3 is ghost patient, harmful to the patient's health. Sorry, my screen is not very clear. Okay, ghost patient. Okay, harmful to the patient's health. Physicians themselves can fraudulently write prescription for money, especially a kickback from from the downstream illegal sale of these drugs. And then number 4 is identity fraud. This kind of fraud occurs where an uninsured individual assumes the identity of an insured person so as to benefit from the services provided in the scheme. And so we all know about health insurance, where a person insures his health. And then in cases where the person's health is not actually insured, and then the person goes to the hospital, maybe providing a fake insurance scheme to the hospital that is insured. For instance, like the National Health Insurance Scheme. And then the person goes there and then the person is treated. And then maybe they later discover that this person is not under any insurance policy. This would amount to healthcare fraud and abuse. Are we getting it?
Yes, we are. Please go ahead, carry on.
Okay. So we'll be moving to healthcare fraud and abuse detection technique. That's what are the methods used to detect fraud in the healthcare sector. Number 1 is advanced data-driven technologies. These are modern techniques adopted or predominantly employed in high developed or developing countries. Advanced fraud detection refers to the use of modern technologies and sophisticated models to identify and prevent fraudulent activities in a more precise and efficient manner. This scientific approach aims to swiftly detect, prevent, and respond to every type of fraud and abuse that would occur in healthcare sectors. Okay. Adekonde, a doctor based in Canada, stated that enhancing transparency, embracing minimally invasive techniques, and utilizing data-driven practices could improve healthcare quality in Nigeria. The advanced data-driven technology include, but it's not limited to the following. Number 1 is machine learning and AI fraud detection systems. AI-driven solutions like Curacell analyze large data sets to identify patterns and indicators of fraudulent claims, potentially detecting fraud with high accuracy. Typically, Advanced fraud detection involves using artificial intelligence, that's AI, and machine learning algorithms, which are designed to analyze vast amounts of data and identify patterns or abnormalities. These patterns or irregularities can help signal suspicious of fraudulent activities in a real time. Two is predictive analytics. This involves using historical data to predict future fraudulent activities, enabling proactive measures. Advanced fraud detection also leverages, sorry, there's a typographical error there. Okay. Moreover, advanced fraud detection integrates with superior identity proofing solutions to prevent identity theft, payment fraud, and account takeover fraud. These solutions usually depend on robust verification methods like biometrics and behavioral analysis to determine a user's real identity. As a result, it has the unique propensity to detect previously unseen fraudulent activities, enabling it to serve as an early warning system. Number three is behavioral analytics. Analyzing user and transaction patterns to identify unusual or suspicious activities that may indicate fraud. Behavioral biometrics is an emerging technique that analyzes a user's typical behavior from mouse movements to keystroke dynamics and uses this data to detect abnormalities that indicate fraud. Analyzing user and transaction patterns to identify unusual or suspicious activities that may indicate fraud. Number three is data mining. Data mining is used to analyze patients' record, physician certificates, and claims data. This allows for the identification of inconsistent or irregularities that may indicate fraud. Number four is identifying patterns of fraud. Data mining techniques can also help to identify patterns and abnormalities. Number five is streaming database and using AI to identify errors and waste can reduce unintentional costs and overcharging. So I think basically one of the keynotes here is the use of AI to detect fraud and abuse in healthcare sectors. So when there's a systematic record of documents, then fraud can be detected easily if records are being taken down in the healthcare sectors. And then for the traditional method, we have number one, manual audit and inspection. Traditional is just like manually, not the use of AI or advanced driven technology tools. So for manual audit and inspection, this includes reviewing claims and documentations through manual review of claims and medical documentation, which can help to detect discrepancies and errors. Number two is ethical training and patient education. Training for healthcare, okay. Ethical training and patient education. This includes educating healthcare providers on ethical practices and potential fraud schemes, which can help to prevent fraudulent activities. Patient education means educating and sensitizing patients about their medical rights and responsibilities or obligations, which can help to deter healthcare fraud and abuse. Number three is strict recruitment policies and internal controls. Strict recruitment policies and internal controls. Number one is background check. That's thoroughly vetting healthcare providers to ensure that they are qualified and trustworthy before recruiting them into the healthcare sectors. Number two is internal control, which means implementing robust controls by the healthcare administrative and management, which can help to prevent activities, that's fraudulent activities within the healthcare organization. So basically, the traditional method talks about manual audits, and this is more like people driven, not like we know the advanced method is AI. The traditional method is more of human resources. That's the people in the organization making sure that they actually take steps to ensure that abuse is reduced in the system. And then slide 11 talks about regulatory law agencies for the regulation of fraud and abuse in Nigeria. Number one is the National Health Act, NHA, enacted in 2014. This act serves as a principal legislation for the Nigerian healthcare sector.
Sorry. When did you say the National Health Act was enacted?
2014.
Okay. Proceed.
Yes, sir. The act serves as a principal legislation for the Nigerian healthcare sector, encompassing regulation, development, and management, including provisions to prevent and address fraudulent activities and abuse. Number two is the National Agency for Food and Drug Administration and Control, that's NAFDAC. This includes regulating the manufacture, distribution, sale, importation, exportation, and consumption of medicines, food, chemicals, cosmetic, packaged waters, and medical equipment, ensuring quality and safety, and preventing substandard products from reaching the market. Number three is National Health Insurance Scheme, the NHIS. The NHIS plays a crucial role in managing health insurance and has a responsibility to issue guidelines to regulate the activities of HMOs and other health insurance players, aiming to prevent fraud and abuse, as well as to protect patient health record. We also have the Medical and Dental Council of Nigeria, MDCN. They are a professional body concerned with the regulation of the medical and dental profession. We have the Federal Ministry of Health. It is a coordinating body for the different health sector functions, that is, regulating the activities of MHO and other health insurance players to prevent insurance fraud, possible discrimination, and other abuse of health record. We have the Standard Organization of Nigeria, SON. This agency ensures that products meet technical standards and provides consumers with quality recommendations. And so now we'll move to recommendation. That's slide 12. Number one is integration of an effective electronic health record and centralized data systems, which could help to enhance fraud detection in resource-limited settings and developing countries like Nigeria. However, Adekunle stated that unlike most international hospitals, many health institutions in Nigeria lack data. This gap hinders their ability to monitor outcomes, identify areas for improvement, and establish benchmarks aligned with global health. Number two is creation of awareness and wide sensitization on ethical training, cultural shift, and patient empowerment, which should be employed in preventing fraud in developing countries. Number three, building collaboration between healthcare providers, insurance, and regulatory agencies emerged as a critical factor for effective fraud management. Number four, sufficient increment in the healthcare budget allocation is essential for the elevation of healthcare standards and in deterring medical or healthcare fraud and abuse, as well as its detecting techniques. So, yeah, we'll come to the conclusion of this work, which says that healthcare fraud and abuse detection technique in Nigeria include the adoption of the advanced data-driven technique and also the usage of the traditional manual and audit techniques, addressing medical fraud and abuse requires a multi-pronged approach, combining the detection, prevention, and legal responses. Advanced technologies, ethical reforms, and robust legal frameworks are pivotal in building transparent and trustworthy healthcare systems. Policymakers, particularly in developing countries like Nigeria, should prioritize capacity building initiatives, international collaborations, and the adoption of cost-effective technological solutions. Thank you.
Okay, that's a good one. Any questions for them before I comment? Any questions for them? Hello?
Hello, sir, we can hear you.
I said, any questions for them before I make my comments?
No questions.
Hello, participants. You people are not engaging in this class. Any questions? Or let me assume that you understood. Your silence for me means you understood their presentation and there are no questions. Okay. Firstly, let me commend the two groups for the depth of their research. We have expressed our displeasure with group 1 for not coming in on time. So barring that, and just a few corrections. Firstly, for group 1, what we have now is National Health Insurance Authority Act. So no longer National Health Insurance Scheme. We have National Health Insurance, that's the law. Before it used to be National Health Insurance Scheme Act. What we have now is National Health Insurance Authority Act 2022. So whenever you are citing a law, ensure that you capture the dates. Okay, let us quickly go into my presentation. You will pick your corrections from there. We have a long way to go because I have combined 25 slides to go through, if not more. Group 2, your major challenge in your topic is that you did not present on the entirety of your topic. Group 2, what is your topic? Hello, Group 2. Group 2, can you hear me? I am not getting responses. Can anybody hear me, please?
I can hear you, sir.
Okay. So, who is speaking? Goswe, right?
Yes, sir.
Tare, you presented for Group 2. What was your topic? Is she still here? Tare, you presented for Group 2. We are having a new person in the class, Rukawe, right? Rukawe Obie, you are a new member of the class. Is that correct? Hello, I am not getting responses. Mr. Dennis, can you hear me?
Yes, I can hear you fine, just fine. I don't know.
Why am I not getting responses?
Please, can we try to collaborate and respond?
If you are not interested in the class, I will just go away. I have nothing to lose, honestly. I can't be asking questions and everybody is silent.
Sorry, sir, I was actually speaking. I didn't know my mic was muted.
Tari, what was your topic?
Okay. The topic given to us was medical malpractice trends and prevention measures. I think that's what I see on the program.
Okay, so there was a tweak in the topic. It's not your fault then, because your full topic is supposed to be medical malpractice, patients' rights, and evidence gathering. I added / legal redress mechanisms. So that's the full topic: medical negligence, patients' rights, and evidence gathering. That's your topic for group 2. Then group 1, your topic is supposed to be healthcare fraud and abuse in Nigeria. You got your topic, even though you added. So let us run. Let's take group 1 presentation, healthcare fraud. Dennis, can you share my slides?
Yes, sir, they're coming up, sir.
Okay. While we wait, Rukowe, kindly introduce yourself. That's our practice here. Tell us, turn on your video. Tell us your name, where you are joining us from, what you do at the moment, and why you joined this class. Have 1 minute to do that, please. Hello, Rukewe, can you hear me?
Yeah, I can hear you. Good evening, sir.
Good evening. You have the floor. Kindly introduce yourself. Turn on your video. Tell us your name, where you are joining us from, what you do at the moment, and why you are in this class. Proceed. Go ahead, Rukewe. Please, can anybody hear her?
I can't hear how.
Rukewe, can you hear us?
I think her network is having issues. I noticed her video and her audio are not logged in, so I think it's a technical issue from my end.
Okay. So let's make progress. Go to the next slide. Go to the next slide. We have a long way to go. Okay, introduction. Scenario. I need you to close your eyes. Just imagine in your head. Imagine going to the hospital. We are dealing with healthcare fraud and abuse in Nigeria. That's our topic, group 1. Imagine going to the hospital with a severe illness. You are told you need an expensive life-saving procedure. You trust the healthcare provider and undergo the treatment. But later you discover that the procedure wasn't necessary at all. In fact, the hospital had falsified your diagnosis for profit. This scenario is not just a plot for a medical drama, it happens in real life. So if you are in that situation, what are you going to do? I need responses from anybody, random responses. If you are in that situation, what are you going to do? Raise your hand.
Sorry, sir, can you repeat the question?
Mr. Ebenezer, are you with us, sir? Hello, sir. Okay, Mr. Ebenezer has been logged out. I'm sure he'll be joining us shortly. Let's just give him a few minutes. I'll try to reach out to him. Hello, sir. Can you hear us? It seems you were logged out, sir.
Yes, sorry, I was logged out, but I'm back now. So I posed a question. I said, imagine you went to hospital and the scenario we painted happened. What are you going to do? I need your answers, please. Go to the next slide. Go to our current slide. This session is practical. It is more practical than theory because it is what we face every day. So, any answers? Who is attempting? I'm not seeing any hands up. Hello? If nobody answer, okay, 2 hands. Okay, God's will, what are you going to do?
So in this type of scenario, if I found out that the hospital falsified my diagnosis just for profit, I would like to
Yeah.
see if I can sue them.
You will like to see if you can sue them.
Yes.
Okay, good. You will like to see. Chiamaka, what are you going to do?
Okay, sir. If I notice that I was like scammed by a hospital with false diagnosis, I'm definitely
Yes.
suing them, and I'll use social media
You
and
are
create awareness
definitely
that
suing them. Okay,
yes.
I like that. We will find out. Healthcare fraud is not a distant concern. It's happening in Nigeria today. In fact, it is an issue that is impacting both public and private healthcare systems, draining resources and affecting patient care. The purpose of the presentation, in this presentation, we will explore the techniques used to detect and prevent healthcare fraud and abuse in Nigeria. By the end of the session, you will have a clearer understanding of the challenges Nigeria faces and the solutions that are being implemented to combat this issue. Next slide. Definition: what is healthcare fraud and abuse? Healthcare fraud is the intentional deception, underline that word, intentional deception or misrepresentation by individual or organizations in the healthcare sector to secure a financial or personal gain. It includes falsifying records, billing for services not provided, or overcharging for services rendered. The purpose of healthcare fraud is for financial gain, either to the individual perpetuating it at his or her own level, or the organization if it is structured that way. I think it wasn't just about 2 sets ago. I told them, I think I mentioned this on Monday too, about a friend of mine whose friend is a medical doctor and he was working in a private hospital. So people will come in when he examines them and finds out that this person doesn't need admission. What this person needs is bed rest. He will prescribe some medication and tell the person to go home and have bed rest for maybe 2 days or 3 days, as the case may be, and the person will get well. If he sees there is no need for admitting you, he does not give you bed. But when he kept doing this, which is the standard practice, his employer, the owner of the hospital, said, "Oga, don't you know that it is from these patients that we raise your salary? If you keep discharging them and telling them to go home, how will we get money to pay you at the end of the day? If they come here, give the person bed to lie down, then administer medications on the person. When the person, after 2, 3, you now bill the person, and that's how we make money to raise your salary." So the young man refused to do that. By the end of the next month, the organization sacked him. Unfortunately for them, before they could sack him, he had already gotten a letter of employment with a federal government hospital. So he was just waiting to resume. As they were telling him, you are hereby fired, he was telling them that he's resuming at the other place. So that is a classic example of healthcare fraud. We talked about overbilling for services rendered, and also falsification of records, and also billing for services not rendered. There are people who go for medical examination, some job opportunities, some job employment demands that you bring medical fitness reports. This person is not medically fit from the result, from the test results. Then the person now tells the doctor to please help, or he or she does not want to lose this job. And the person now collects money from the patient and now writes a different result. That is healthcare fraud. And that one has far-reaching implication on the life of the patient, because the patient might be given tasks, particularly if it is a military personnel or force, he might be given a task based on his medical record and fitness reports. Then he goes there to collapses. They will blame village people, not knowing that it is a result of healthcare fraud. Example, a doctor billing a patient for consultation that never took place or inflating the cost of prescription medication. Healthcare abuse, the practice of engaging in activities that are inconsistent. We talked about medical ethics in our first lecture. Activities that are inconsistent with acceptable medical business or professional practices, leading to unnecessary costs or services for patients. Example, prescribing medication for financial incentives, even when it is not needed for the patient's health. I've already shared the example of my friend's friend. Why does healthcare fraud and abuse matter? Why? What's the impact? Substandard healthcare or unnecessary procedure can harm patients, causing unnecessary physical, emotional, and financial distress. This is self-explanatory. Impact on the system. Healthcare fraud diverts resources away from the care that should be provided, increasing the financial burden on hospital, insurance companies, and the government, where people come to make false claims. You see that the hospital, the HMO is expending more when people come to make false claims. The health maintenance organizations, the insurance companies, they are spending more because they are paying for what does not exist. Then economic impact. According to Nigerian National Health Insurance Scheme, healthcare fraud, this was 2018. By then, it was still under National Health Insurance Scheme. That's why it's like this. So, sorry, 2019. The healthcare fraud leads to billions of naira loss annually, which could be better spent on improving healthcare infrastructure services. Statistics in 2019, Nigeria's healthcare system was estimated to lose up to 200 billion annually to fraudulent activities. It is estimated that healthcare systems lose around 10% of their spending due to fraud abuse, making it critical issue. That's 1/10 of the health budget is lost to fraud and abuse. Then approximately 455 billion of the $7.3 trillion spent on healthcare annually worldwide is lost each year to fraud and corruption. The sources are there. So these are not my figures. Types of healthcare fraud, billing fraud. These are false claims. Hospitals or doctors submit inflated or fabricated claims to health insurances for payment, upcoding, billing for higher price services or procedures than those actually provided. We've talked about this, where services that are provided, we now bill a higher amount for them. Then fake prescription fraud, fake prescriptions, writing prescription for drugs that are not needed, drug diversion, selling prescribed medications illegally. There are some medications you cannot get over the counter. They are only sold by prescription. Dennis, can you move the slide? I'm using the one on my system. Hello, Dennis. Good. So there are drugs that are only sold over the counter. Or rather, there are some drugs that are not sold over the counter, meaning you cannot walk into any pharmacy and just request for them and get them. They are sold based on prescription. The doctor has to prescribe it before you can access it. But you find pharmacists selling those drugs to people. It's fraud. Identity theft. Fraudsters use stolen patient information to make false claims. Then kickbacks and bribery. Healthcare providers offering or accepting bribes in exchange for patient referral or medication, or even bed space. I gave example of when we had COVID pandemic and there was scarcity of ventilators. So attention was focused on providing ventilators for the rich and wealthy when they come into hospital. Now, that is healthcare fraud. It runs against the principle of justice when with the unequitable distribution of resources, if you recall our discussion on ethics. So, next, challenges in dictating healthcare fraud in Nigeria. Lack of comprehensive monitoring system. Many healthcare providers lack real-time oversight, making fraudulent activities harder to track. You know, the use of technology is so powerful. Unfortunately, I feel that our governments and persons in authority are deliberately lagging behind in deploying technology to solve a lot of problems, particularly things that relate to finances. They prefer that manual approach, even though it takes eternity, because it is in doing it manually that they will see opportunity to divert funds. Weak legal framework. Despite existing laws, the Nigerian Criminal Code and other anti-corruption legislation, that's the ICPC Act, EFCC Act, enforcement is often inconsistent and penalties for offenders are weak, particularly when it relates to healthcare fraud, because ICPC and EFCC, they beam their searchlights more on politicians, more on Yahoo boys for EFCC, then ICPC more on civil servants. So nobody actually takes cognizance of or thinks of beaming their searchlights towards our healthcare sector. Inadequate training. Many medical and administrative staff lack the necessary training to recognize and report fraud. Yeah, it takes training. How do you track? How do you, when you recognize, how do you even recognize it? How do you track it? What is the procedure of reporting? How do you go to confront the person directly? Do you report to the management? If you're reporting to the management, is it verbally? Is it in writing? Is there a designated office? What about protecting the whistleblower policy and all that? Then downplaying the far-reaching effects of healthcare fraud and abuse. Seeing healthcare fraud as an isolated event without looking at the compound or cumulative effect in sabotaging our overall healthcare delivery makes the government reluctant in investigating the required fund, in investing, the required fund to combat, not compact, combat healthcare fraud in Nigeria. Let me correct it from here. To combat healthcare fraud in Nigeria. So the government sometimes, they do not, because they don't have the cumulative effect, they view each case, okay, how much? 200,000, okay, 150, okay, 500. Is that why we should invest 5 million or 10 million to set up a system because of 500,000? Now, they are not looking at the cumulative effects. They are looking at setting up a system for one hospital. They are not looking at the aggregates in 5 years, in 10 years. They are not looking at the incalculable effects or damage it does to the patients involved. So it makes them reluctant to pursuing healthcare fraud or investigating healthcare fraud. Techniques for detecting healthcare fraud: data analysis and pattern recognition. We talked about training. So how do you recognize patterns of healthcare fraud and abuse if you are not trained? So using technology to analyze billing patterns, detect anomalies, and flag suspicious claims, machine learning algorithm can automatically identify unusual billing activities. Example, software tools that compare healthcare provider claims against national average to identify excessive or unnecessary treatments. 2, audits and review, regular and random audits of healthcare facilities and providers by insurance companies or regulatory bodies. Example, the National Health Insurance Authority. There is a council, there is a board now set up under the Act. They should regularly audit hospitals and health maintenance organizations to ensure that claims match actual treatment provided. So if you see section 3Y, Z, and BB of the Act, it has to do with the functions of the authority and the governing board. So part of their functions is the sections I quoted there. Then whistleblowing reporting system, encouraging whistleblowers to report fraudulent activities without fear of retaliation. Implementing anonymous tip lines or online platform for reporting fraud. Now, this one is more theoretical than practical in Nigeria. Do you know why? If you recall, sometime in 2016, 2017, the Federal Minister of Finance brought up a whistleblowers policy. Please, are we following?
Yes, sir.
Okay.
Yeah.
Sometime 2016, 2017, the Federal Minister of Finance brought up the whistleblowers policy as a measure to fight corruption. And it was stated that anybody who reports corrupt practices or stolen wealth, actually, the target was stolen monies. Anybody who reports stolen wealth, we get 5% of that money, the recovery done. That was the time, if you remember, people began to find money anywhere. You will just see reports that money has been found in mud house, money has been found in toilets in soccer way, money has been found in GP tank. We started finding money everywhere. But firstly, the website of the Ministry of Finance collapsed within 3 months of making that announcement, because people were reporting their brothers, people were reporting their uncles, people were reporting neighbors, and we started finding money. So due to the huge number of activity and reports on this, the website collapsed within 3 months. They had to rebuild. But that's not the case. The more pathetic issue here is that the government did not keep up to its promise. People were not compensated and they stopped reporting. More so, that was just a policy. There was no law backing it up, such that people who were not given their due rights or claim would have gone to courts. So the federal government was smart to make it a policy and not a law. So I am bringing this because we need to learn. It's not just theory. If it didn't work, we know why it did not work and why it may not work. So for this to work, there has to be sincerity of purpose on the part of the government, demonstrated by action. Next, techniques for distracting fraud continues. That's true. Collaboration with law enforcement agencies. Now, healthcare fraud detection often requires cooperation. So it is not what one person can do as an individual. So it requires collaboration. Now, we are suggesting that there should be joint investigation between EFCC, 1, ICPC, 2. ICPC is more for civil service, so ICPC can comfortably do this. ICPC with hospital management and HMOs, health maintenance organizations, their management, they can combine to do investigation on healthcare fraud within the healthcare system. Then legal framework, we have the National Health Insurance Authority Act. Group 1, you have seen it here. So you take your correction from here. It provides a framework for health insurance administration in Nigeria. It provides for offenses and also punishment for violating the provisions of the Act. So you see section 48(1), E, F, and G provides for offenses. What constitutes offense? One of it is manipulation of a patient's documents, manipulation of enrollees' information. Another one is trying to enrich yourself. They are all here. Then section 48(2), A and B provides for the punishment. 48(1) provides for offenses. There are a number of them there. 48(2) provides for punishments. Then the same thing with 48(3). Then section 49 as well, criminal code and penal code. These laws provide penalties for fraudulent practice or practices, but the challenge remains in their enforcement within healthcare. If you remember the popular 419, this person now 419 and now is into 419. How did we come about that 419? It is the provision of section 419 of the penal code. In the early 90s, that advanced fee fraud was beginning to gain prominence. So anytime they charge somebody to court, it was always under section 419, section 419, section 419, which talks about obtaining by false pretense. So that is how the offense of deceiving someone or collecting something honestly from somebody was tagged or coded 419. Now, the penal code, the criminal code applies in southern Nigeria. The penal code applies in northern Nigeria. The penal code also has a similar punishment, but it didn't use the word fraudulently. Instead, in the penal code, we have the word dishonestly. So whether you did it fraudulently or dishonestly, it is an offense. Then, Code of Medical Ethics, 2008, another code of professional conduct for other healthcare professionals. Now, Code of Medical Ethics is for medical doctors. Nurses have their own, pharmacists have their own, laboratory scientists have their own, and so forth and so forth. So we thought that we also have the Code of Medical Ethics provides for standard for healthcare professionals. If you recall our ethics class, though more needs to be done to enforce these rules against fraudulent activities. Now, you need to also understand that this code of medical ethics, they are not laws. So they are not enforceable in courts, but the professional bodies can punish their members as stipulated in their code of ethics, professional ethics. However, the same action that the code of professional ethics frowns at, there could be an equivalent in our penal or criminal code. So if we find the same thing in our penal code, we can still take the person to court and try the person under our criminal law procedure. Then anti-corruption legislation, we talked about the EFCC and the ICPC Act. Those acts empower the respective agents to investigate economic crime and corruption. Next, conclusion on this. Healthcare fraud and abuse in Nigeria are pressing issues that affect not only the financial health of the system, but also the physical well-being of patients. While there are significant challenges, the implementation of advanced detection techniques such as data analysis, audits, and whistleblowing can drastically reduce its prevalence. Punishment of offenders using the existing laws or improved legal frameworks will deter others from committing this heinous offense against our healthcare system and by extension against patients and healthcare users. Fighting fraud in healthcare is not just about finding the criminals. It is also about creating a culture of integrity where patients trust that the care they receive is what they truly need, not just what generates profits. As future lawyers, doctors, and healthcare professionals, you have the opportunity to contribute to a more transparent and just healthcare system by A, understanding the legal frameworks in place to prevent healthcare fraud and abuse in Nigeria. B, by being vigilant in your practice, whether in medicine or law, towards identifying fraudulent activities. And C, by encouraging reporting and transparency within healthcare setting. The fight against healthcare fraud and abuse begins with you. Your predecessors, particularly for our medical students here, those who are already in practice, they did not have the privilege you have now to get this information at your level, at this level. So you need to come into the system with a different mindset of correcting the system. So you are going into the system as an ambassador of integrity, as an ambassador of transparency, as an ambassador of fighting healthcare fraud, or not fighting per se, an ambassador of stopping healthcare fraud and abuse. So thank you. Any question on this topic? Any question? If there's anything you did not understand, let's have it. Let's discuss this. Questions? If you have any question, kindly raise your hand.
Good evening, sir.
Okay.
Good evening, sir.
Good evening.
Yes, sir. Please, okay, my name is Fina. Please, I
Yes.
listened to you when you mentioned that most of the laws, let's say for instance now, fraudulent actions of healthcare providers are only policies, but they are not laws. Why is it so? At the detriment of the client whom they are attending to. I mean, if the client intends to sue the healthcare providers for, let's say, for instance, particularly with reference to overdosage of drugs or over specification of drugs that are not even related to the health incident of the person, the patient in question.
Okay. You are taking me into our next topic, which is medical negligence, patients' rights, evidence gathering, and and legal redress or redress mechanisms. I did not say that most laws are policies. Get it right. I spoke specifically about a suggestion I made here, whistleblowing and reporting system as a technique of combating or dictating healthcare fraud. What is whistleblowing? Somebody reporting. Maybe a staff has seen something going wrong, and the person reports to say, this thing, something has gone wrong. But there's a challenge with that. The challenge in our climb, because we said that is slide 7. Dennis, go to slide 7. Hello, Dennis. Please go to slide 7. We said,
yes, sir, I'm trying to get the slide
here. The number 3 technique suggested whistleblowing and reporting system. We said encouraging whistleblowers to report fraudulent activities without fear of retaliation. The truth in our system, I want to be practical so that you are not deceived. This course is practical for me, not theory. The truth in our system is that you, as a whistleblower, you will finish your whistleblowing by reporting. Then the agent that is supposed to take action, which you have reported to, somebody from that agent now calls the person against whom you reported to say ABC made a report against you. Do you understand it? Hello, Fina, are you here?
Yes, I'm here. I understand you, sir.
Have you wondered, has it been a concern to you how some documents that are supposed to be confidential government documents find their way to the internet? Not after 20 years, not after 10 years, as in something happens today, and it's already on the internet.
So that is very common in Nigeria.
When President Buhari was in office, then we say, okay, there will be presidential broadcast by 7 p.m. By 6 o'clock, the thing the president is coming to read his broadcast, his speech is already online. So we are saying here that there are consequences to whistleblowing, and that the government should put a policy in place to protect the whistleblower such that he is not intimidated, or the persons he complained against doesn't come back to haunt him. That's 1. 2, I now made an example expressly stating that the Federal Ministry of Finance attempted a whistleblowing policy between 2016 and 2017. And they said anybody who reports, who blows whistle that somebody has stashed out some fund somewhere, someone has hidden money somewhere, if that fund is recovered, you'll be given 5% of what is recovered. How many of you remember the incident of one mud house in Kaduna? That was the mud house with AC, but inside it was filled with money. Somebody reported that case, believing that the government will live up to its promise of 5% of what was recovered. Nobody was paid. And different cases like that. So when was the last time you heard that money has been found in a mud house? So that's why I said that that particular policy was not a law. Had it been, it was a law, people can go to court to claim what is duly theirs. So not that we have, by the time we go to our next topic, we have laws that can deal with issues of medical negligence, issues of patients' rights violation. That is our next topic now. Thank you. Is it understood now, Fina? Is it clear?
Sir. Yes, sir. I'm clear, sir. Thank you so much, sir. Thank you, sir.
You're welcome. Any other question on this, please? Any other question on this? If there is anything you do not understand, kindly ask before we make progress. Okay, in the absence of any other question, Dennis, kindly post our second topic. Rukewe, while he is doing that, kindly introduce yourself.
Hello.
Hi.
Good evening.
Good evening.
Sorry, my phone overheated and shut down. I am Rukewe Obie. I got your question. I'm a graduate of Human Anatomy and Cell Biology. A friend shared the link with me, and I'm particularly interested in this health tech and law. So I'm prepared to expand my knowledge in this.
Okay, awesome. You graduated from which institution?
Delta State University, sir.
Okay, where are you joining us from? Delta State or Lagos State or Sokoto State?
Delta State, Suleja.
Suleja, okay. Are you in practice now?
No, sir. I work online. I'm an online instructor. I teach online and a researcher.
Okay, what do you teach?
I teach anatomy. I lecture on biology. I once taught elementary class, but now I lecture on biology and anatomy.
Oh, that's good. For which institution?
It's not an institution. It's just like a personal tutorials for students who couldn't or can't find time to understand. So I create classes for them, like a tutorial.
Oh,
yes,
that's
sir.
good. That's good. I hope they are paying you money.
It's voluntary, sir. It's voluntary.
Oh, that's good. Oh, that's good. God bless you. Keep it up. Keep it up in the interim. And very soon, you will get employment. But you can convert that to an employment. So you must not wait till you have already created an employment for yourself. If you put your knowledge together and package it and advertise it well and put a fee to it, students will be paying to learn, because in fact you will always have customers. There will always be students. So think about the free consultation I gave you now.
Thank you, sir. I'll work on it, sir. Thank you very much, sir.
Okay, you're welcome. So let's go to our second class. This class, I told Dennis to tell everybody that this class is compulsory, because this particular topic is the hallmark, is the fulcrum, is the foundation of this course. Now, by the time we go into it, you will understand. It is very broad. I had told them, the faculty, the management, to just make medical negligence, as in this topic, let it be one topic. You know, we have treated healthcare fraud and abuse, and we are treating this. Then please take notes in the next quarter class. Let medical negligence, patients' rights, and evidence gathering be a sole topic on its own, just one topic. These are 3 topics. We cannot treat medical negligence in 3 days. It is a topic in the university under law of thoughts. We treat it like so. You understand what I mean? Let's go. Imagination scenario. Imagine, introduction, please, Dennis. Imagine walking into a hospital to seek treatment for a minor issue, only to be left with lifelong complications due to a medical mistake. What would you do if you found out that the healthcare provider responsible was neither held accountable nor willing to address your grievances? What will you do? Let me have responses, not from the 2 people. another set of people, what will you do?
First, I will consider whistleblowing, and as a lawyer, definitely I will sue for the negligence of the health, medical health providers.
Okay. Sorry, I didn't get your last comments.
I said, first, I will consider the alternative of whistleblowing, and where
Right.
that doesn't work, because the negligence is directly on me, impacted on me, I definitely will sue, in court.
Okay. A lawyer said she will sue. Who else? Who else? Who else? I need another contributor.
Okay, sir. Good evening.
Good evening.
Okay, so just like the previous person said, I'll definitely file a suit. I'll also report the healthcare provider to the medical board, the board of medical professionals. Okay. Yes.
Okay. How come nobody is praying? Huh? Why are you people just swing? Nobody will pray about it. Okay, let's make progress. Purpose and scope. This presentation aims to explore medical malpractice in Nigerian healthcare system, the rights of patients, the critical processes of evidence gathering when seeking justice. We will discuss, or we will address how medical errors can happen, the legal avenues available to patients, and how individuals can prove malpractice. By the end of this lecture, you will understand the balance between medical professionalism, the rights of patients, means of evidence gathering, and the role of law ensuring fair treatment for all, as well as redress mechanism available to victims of patients' rights violation or medical malpractice. Now, Tari took my correction last week. I am sticking to use of medical malpractice and interchanging it because that's how the topic came. Now, for avoidance of doubts, or now that you are in this class, medical negligence is an error. People use medical malpractice interchangeably. Some authorities will tell you that medical malpractice is a larger scope of medical negligence. In fact, that medical negligence is under medical malpractice, and that while medical malpractice is an error, while medical negligence is an error, medical malpractice comes on board when the error leads to harm. Please understand this. Very simple. Medical negligence is error, failure of the healthcare professional to use the requisite skill and experience of a professional of his standing in attending to patients. Meaning that if the healthcare provider is a consultant, we are expecting a certain level of expertise from a consultant. There are things a consultant knows that a doctor under housemanship does not know. So if a doctor under housemanship is attending to a patient, there is a limit to his knowledge. We do not expect him to take decisions as a consultant. However, he must, emphasis, he must restrict himself to where his knowledge ends. So at his level, there are things he cannot handle. When he gets to that border where he cannot handle this, what he's supposed to do is to refer to the consultant or an expert in that field. But where he insists and now wants to continue, that is when we will say he became negligent. Now, there is a thin line here for his own action, because he cannot forget that he does not have expertise here. So it is actually malpractice in his case, because the difference between medical negligence and medical malpractice is intention. In medical negligence, it is inadvertence, it is omission, it is a mistake, it is an error. In medical malpractice, it is deliberate. And in most cases, the healthcare professional involved knows the outcome, the likely consequence of what he's doing, that this thing is going to cause harm to the patient, and he goes ahead to do it. That is one hand. On the converse is where a consultant gynecologist, he's a consultant gynecologist, now decides to take up a cardiology case. He goes to take up a cardiac matter. It is not within his area of specialty. What is he supposed to do? He's supposed to refer. So if he now decides to go to conduct a heart surgery, he is not an expert in that area. So he will be held to have committed medical malpractice, because he knew that he doesn't have the expertise required. He knew that whatever he's going to do there is going to cause harm to the patient, and he went ahead to do it. So I needed to get these explanations. Let's proceed. Example, Dr. John's case. Imagine a surgeon who fails to sterilize instruments properly, leading to an infection. This will be considered medical malpractice because the action deviated from the medical standard of care. Now, why is it medical malpractice? He knows that before he conducts surgery, his equipment is supposed to be sterilized. In fact, there's usually SOP, standard operation procedures, placed. Your pre-operation procedures, you place it somewhere. Those in medical, this thing, am I lying? Omosusi, you're here, right?
Yes, sir.
Am I correct?
Yes, sir.
Okay. Then any other question I have today is for you. Why is Emmanuel not in this class?
I don't know what's going on, sir. I reached out to him last time and he said he had light issues, but I don't know why he's not here right now.
He has not attended any of the lectures, to my knowledge.
I'll reach out to him again today and find out what's
going on. Brought you people in. Okay. So you place your procedures, standard operation procedures. What a checklist of what must be done. Step 1, do this. Step 2, do this. Step 3, do this. Step 4, do this. The equipment you are using, you put them a list. Step 1, we have this, we have this, we have. When you are done with operating, you go through your list and take out all the equipment to ensure that everything that you took in, you brought them out. Now, you suddenly forget to sterilize. You see, you did not follow we understand that the human memory can fail. That's why an SOP is provided. Just look at it, read, what am I supposed to do? Do this, do this, do this, do this, do this. But in failing to do that, you become culpable or liable for medical malpractice. Core elements of medical malpractice, this is actually supposed to be medical negligence. Duty of care. One, a doctor owes patients duty of care. There have been arguments as to when does this duty arise. Some authorities postulate that once the patient walks into the hospital premises, a duty of care has arisen. Others postulate that once a doctor has accepted to take care of the patient, a duty of care has arisen because the doctor might refuse to take care of the patient. So the doctor owes patient duty of care. And what duty does the doctor owe the patient? Basically, there are four. Amongst all the duties, the doctor owes the patient four cardinal duties. And what are these four cardinal duties? One is an obligation to diagnose and treat. It is an obligation. Two, an obligation or duty to provide information, relevant information to the patient. Three, duty to ensure that patients give free and informed consent. Four, duty to respect patient confidentiality. All the duties, including duty to respect the rights of the patients and other, but these are the 4 or 5 cardinal duties a doctor owes a patient. There are many more, but to diagnose and treat properly, to provide information, relevant information, to ensure patients give free and informed consent, confidentiality and respect to patients' rights. Those are the 4 cardinal duties a doctor owes a patient. So can we go to the next slide?
Sir, I've been trying to follow you, but I don't know on which exact slide you're on.
No, I was explaining. Just go to slide 4 now. Let's look at some acts that constitute medical negligence. What are the things that a doctor, a healthcare professional can do, and I will say he was negligent? Misdiagnosis is one. What is misdiagnosis? Diagnosing the wrong ailments. A lot of people have died in Nigeria because they were wrongly diagnosed. The one that pains me personally is the person of Chief Gani Fayomi. This is a man I have adored from my university days, reading his work. In fact, we were still in university when he did it. The day Gani died, I cried as if he's someone I know personally. I followed Gani Fayomi to the extent that when his will was released, I had to go and get a copy of Gani Fayomi's will. But what killed Gani Fayomi? As far as I'm concerned, primarily misdiagnosis. He had a different ailment and he was being diagnosed of a different ailment here. By the time they could get the real problem, it was already too late. So misdiagnosis, such as diagnosing a person with irritable bowel syndrome when they really have ovarian cancer. Can you see the difference? The person has ovarian cancer, but you are diagnosing irritable bowel syndrome. Failure to diagnose at all, such as missing the symptoms of a serious heart disease. Then, failure to perform or order appropriate medical testing. Failure to adequately monitor a patient. Anesthesia mistakes. It could be with dosage. It could be where the person is supposed to do a local anesthesia, you go and do full body anesthesia. So anesthesia mistakes generally. Failure to warn patients of known risk associated with treatment or medication. There was a case of someone who was having a challenge, and when they were treating him, they didn't inform him that the medication they are giving him was likely to cause deafness to him. So when they started treatments, at the end of the day, the man went deaf on one of his ears and he sued and got judgments. Illegible or sloppy handwriting. Come, our medical students, do they teach you people special writing? I need to know.
I don't think we've gotten, I think, I don't think I've gotten to that part yet in my medical training, sir.
Okay. So how come that when a doctor writes his bill, we see it well and read it? But when he writes his prescription, we don't see it. Why?
I don't know about that, sir.
What do you mean? You don't know? Okay. So sloppy, illegible handwriting. Now, the problem with handwriting here, you know, some drugs, some medications, their names are so close. I hope you are aware that if you are not trained, you will not know the difference. If you are not either a medical doctor or a pharmacist or a healthcare practitioner, even some healthcare practitioners may not know. So you discover that you might prescribe something and the doctor the pharmacist will give a different medication because of handwriting error. Then it can also come out in those, you know, a lot of the chemist shop we call it, these are just patent medicine dealers. A lot of them are not trained pharmacists. So because they are primarily in business, once they see anything that looks close to what they need to sell the drugs on the shelf. They also need to sell off the ones that are likely to expire quick, the ones that their expiry dates are close. So you people should work on your handwriting. Medication and prescription error. My WhatsApp has a challenge. If not, there was an article I wrote on patients on God help me. Medication error. That was World Patient Safety Day 2022. The theme was on medication error. I wrote an article that was published in the newspaper, medication error, the role of the patients, because we blame doctors and healthcare professionals. What medication harm, rather, the role of the patients. That was the article. I would have sent it to you people to read. Now, medication error, prescription error. Sometimes your medical jargon, the patients do not understand it. I had a personal experience. A consultant in a hospital I was nursing my uncle, that should be around 2010. He came and made a prescription and wrote you people's Latin. And he gave it to the team of doctors, student doctors that were working with him. None of them knew the medication. He gave me. We went to different pharmacies in Umuahia. Basically, we went to Grace and Mercy. We didn't see. We went to Blessed. These are the two prominent pharmacies in Umuahia. We didn't get the medication. We went to Aba. We didn't get the medication. Why? Anybody we show, say they don't have it. Some say they don't know it. And we came back. And the man said, you mean you didn't get this medication? I said, we don't know it. They said they don't have it. You mean you didn't find this thing? I said, they said they don't have it. He said, this is Andrew's liver salt. I was mad. If not that, it was, in fact, I didn't know the reaction I wanted to have. Because the money we spent then from Umuahia to Aba can buy us half carton. of Andrew's liver salt. So what's the difficulty in telling us that this is Andrew's liver salt? Now, if that delay in trying to prove that you are a consultant and something went wrong with the patient, it is negligence. Failure to obtain informed consent, improper use of medical device, incorrect treatments, botched surgical procedures, leaving a surgical equipment or instrument inside a patient. We have random cases of this in Nigeria. Proof of medical negligence. To prove medical negligence, a plaintiff is required to establish the following. One, that the doctor has a legal obligation to him. That's duty of care. The doctor owes you, engage this healthcare professional to treat you. Now, understand, for healthcare professionals, for doctors, you are not under any law to accept a patient. You are not under any obligation to treat a patient. But the law is, once you have taken up treatments, you must treat that patient according to the required medical standard. So you will not have to say, I was doing it pro bono. I was doing it free of charge. So he didn't pay me. That's not a tenable excuse. Once you have taken up treatment, you are required to treat according to standard. For example, you people are on a journey and an accident occurs. If you keep quiet inside that vehicle, nobody will hold you liable. But the moment you open your mouth and say, I am a medical doctor, please give way, and you start taking care of that patient, you are that victim of accident. You are required to treat according to standard. So if you have taken up an accident victim, you owe that accident victim duty of care. Of course, consideration will be had to the environment, where the medical equipment around you and all that. If you are treating in the middle of nowhere and you do not have medical equipment, that could be factored. But the basic first aid procedure, maybe you are trying to give CPR and you did it wrongly. Those basic procedures, you are supposed to do it the proper way. So the patient needs to establish that this person owed me duty of care, whether the doctor was treating free of charge or he was treating for money. Duty of care is established. 2, breach of the duty the doctor has failed to fulfill his professional or legal obligation to the victim or plaintiff. So breach of duty, you owe duty of care, you breach the duty by not doing what you are supposed to do or by doing what you are not supposed to do. That is breach of duty of care. Number 3 is supposed to be harm before we talk causation. So number 3 is harm. The plaintiff must demonstrate actual damage, that there was a physical or financial harm as a consequence of the defendant's, that doctor's, departure from the standard of care. So you owe duty of care, you breach the duty of care. Now the patient has suffered harm. He has suffered loss of organ, he has suffered loss of limb, he has suffered financial losses because of associated illness that he began to treat as a result of your negligence. Causation, the link between the harm the patient suffered and the breach of duty of care. So where there is no harm suffered, medical negligence case automatically fails. Where there is no harm suffered, the case fails. So these are the 4 ingredients of negligence: duty of care, breach of duty of care, harm, then causation. Causation proves that the injury the patient suffered was caused by the doctor's negligence. And negligence could be doing or not doing a required act. Then we look at hospitals' liability for medical negligence. There are basically 3, 4. One is doctors could be sentenced to jail, criminal liability. Where does criminal liability arise? Where the negligent conduct or action of a doctor leads to loss of life. That is either death or manslaughter. If it is death, or rather if it is murder, that means the doctor deliberately killed the patient. If murder was established, of course, it's capital punishment. The doctor will also face his own death under the law. If it was reduced to manslaughter, that is life imprisonment. Then cases of organ loss, particularly organ harvest, theft of organ, where somebody goes into hospital for surgery and the person's kidney is removed without his knowledge, a woman's womb is removed without her knowledge, all those things are thefts. They are organ harvests. So if it is established that that was done, no, you cannot mistakenly remove a woman's womb. You cannot mistakenly remove somebody's kidney as a healthcare professional. You say it was an error. You can't do that. So it is medical malpractice because you knew that this will be the likely consequence. For a woman, you see that you have rendered that woman childless for life, except there's a miraculous intervention. She cannot conceive. Where will the child, where will the baby stay? Where will the fetus stay? Where there is no womb. Civil litigation. There could be civil liabilities. Damages could be awarded against the doctor in civil suit against his person. Now, for criminal liability, we will still discuss it when we do the patient's rights. So let me just rush. Vicarious liability. The hospital could be held vicariously liable for medical negligence of their doctor or nurse. There are cases to that effect, decided cases. I didn't just want to bore you with those. Now, a hospital can be held liable for the actions of a doctor, but that is where the healthcare professional is an employee of the doctor. But where the healthcare professional is an independent contractor, that healthcare professional will answer for himself. Then, professional disciplinary measures. The doctor could be disciplined by the Medical and Dental Council of Nigeria through their tribunal. We will still talk about this when we get to medical negligence. So, to patients' rights, here we are. Patients' rights, understanding patients' rights. What is patients' rights? 1, patients' rights is a subset of human rights. 2, patients' rights are fundamental claims that empower individuals to demand respectful and ethical treatment from healthcare providers, encompassing legal and professional obligations to uphold confidentiality, informed consent, and quality care. We're saying that patients' rights are claims that empower individuals to demand. It is not a favor. So if it is a right, you can demand for it, to demand respectful and ethical treatment from healthcare providers. Now, this ethical treatment encompasses legal and professional obligation. Why are there legal obligations? Because there is a provision of the law that have stated how doctors should do their job. So that makes it a legal obligation. Then professional obligation. By your training as a healthcare professional, you have the requisite skill to do this job. Now, the third definition is my definition of patient's rights. That's why I put my name there. Patient's rights are those rights that guarantee professional, quality, transparent, and safe healthcare delivery to a patient, as well as respect for the dignity of the person of the patient by healthcare professionals while providing healthcare services to the patient. Now, let's break this down. There are 5 components in this definition. Patient's rights must, first of all, contain professional. The treatment, rather, a patient is receiving must be professional, 1. It must be qualitative, that's quality 2. It must be transparent, 3. And it must be safe, 4. And the patient's right to dignity of his person must be respected. These are the 5 components of patient's rights as defined by Ebenezer Ikwazu. So if these 5, any of these components is missing, the patient's right is not complete. So time will fail me to give detailed explanation of each of those components. It is not for this class. So let's make progress. Sources of patient's rights. While you are here, it's important you don't just hear patient's rights, and you get excited. Yes, patient's rights. What are the sources? How are they derived? Where did they come from? So there are 6 major sources of patient's rights. 1 is international conventions. What are international conventions? Treaties that bind the whole world. Conventions that bind the whole world. One of it is Universal Declaration of Human Rights, 1948. That is the first document that talks about international human rights. Today we are shouting human rights, human rights. This is where it came from. Universal Declaration of Human Rights, that is one international treaty. Another, because I chose these 2, the Universal Declaration of Human Rights has to do with law. Then the Declaration of Geneva, that is the Geneva, not Jennifer, please. The Declaration of Geneva, the Hippocratic Oath. The Declaration of Geneva, that's physician's oath. Once doctors are being inducted, they take this oath to uphold the standards of medical practice. To practice medicine with respect. In fact, the latest version, they have added respect to patients' rights and all that. Does any of our medical students know the Hippocratic Oath? Are they still here? Hello? Chiamaka?
Yes, I'm here. Sorry. Yes, I know it.
Okay, good. So that is an example of international source. 2, acts of the National Assembly. These are laws made by the federal legislation. The Constitution is an example. It is a federal law made by the National Assembly. The National Health Act of the National Assembly. Compulsory Treatment and Care for Victims of Gunshot Act 2017. There are a whole lot of them. The National Mental Health Act, this one we're talking about today, National Health Insurance Authority Act 2022. These are laws of the National Assembly. Then we have state laws. Example, persons living with HIV/AIDS law, number 17, Lagos State, 2007. It's a state law. Rivers State has passed Compulsory Treatment and Care for Victims of Gunshot Act 2022 by Rivers State under Wike. That is a state law. So these state laws confer patients' rights. Some provisions there provide for patients' rights. Then we have Professional Code of Medical Ethics and other healthcare professionals. We talked about it. Code of Medical Ethics 2008 for doctors. Nurses have their own equivalent, the same with pharmacists. Then policies and regulations of relevant government agencies. That is where the Patient's Bill of Rights fall under. A lot of people shout Patient's Bill of Rights, Patient's Bill of Rights. It is not a law. It is a policy document that brings out what patients' rights are for sensitization purpose. You cannot go to court and rely on the Patient's Bill of Rights. So those rights contained under Patient's Bill of Rights are already hidden in other documents we have talked about. The challenge with patients' rights enforcement is that patients' rights are not contained in a single document. We've talked about National Health Act. There are some rights. They're not all. Compulsory treatment and care for victims of gunshots have some rights in there. The Constitution under Chapter 4 has some rights in there. Here and there, we have them. So Patient's Bill of Rights is under policy and regulation of relevant government agency. Patient's Bill of Rights was produced by Consumer Protection Council then, now Federal Competition and Consumer Protection Commission, in conjunction with Federal Ministry of Health. That was in 2018. So we have standard minimum guidelines for human rights of COVID-19 patients in treatment centers in Nigeria, 2020. This document was produced by National Human Rights Commission during the lockdown. Then adjectival law, law of contracts, law of torts. So these are sources of patients' rights. When the contract law tells you about offer, acceptance, capacity to contract, intention to create legal relations, and all that, under law of torts, negligence is a topic of its own under law of torts. Then we move. Patients' rights applicable in Nigeria. There are some rights you'll be hearing for the first time here. Some you don't even know about them at all. Some you don't know they are your rights, but we will look at them together. Patients in Nigeria are entitled to a range of rights when it comes to healthcare. These rights protect individuals from unfair practices and ensure that patients are treated with respect and dignity. Patients' rights applicable in Nigeria include the following. One, right to treatment in emergency situation. I have provided the sections of the law, their sources in all of them. So, right to treatment in emergency situation, Section 20 of the National Health Act, Section 1 of the Compulsory Treatment and Care for Victims of Gunshots. Then it is also provided under the Patient's Bill of Rights. I omitted that. Rights to information. Now, there are 5 components of rights to information. Right to information, 1, on the nature of the patient's ailments, 2, on the diagnostic procedure, 3, on the available treatment options, 4, benefits and costs and associated risks, 5, consequences. That's the same, cost and associated risk and consequences with each option. Then 5, the rights of the patient to refuse and the consequences. So, right to information, you tell the patient the nature of his ailment, 1, the risk implication, the nature of his ailment, 1, the treatment options available, not the treatment option your facility can offer, the treatment options available, the diagnostic procedures, the benefits, costs, and the associated risk of each treatment option. Then the consequence associated with each treatment option, and the right of the patient to refuse. You after telling you, Oga, you have a right to refuse. It is based on that the patient can make informed consent, or can give informed consent. This is provided under Section 23 of the National Health Act. We also have it in the Patient's Bill of Rights. Then rights to informed consent proper, Section 19 Code of Medical Ethics, It is also under the Patient's Bill of Rights. Rights to confidentiality to your medical records, Section 26 of the National Health Act. Rights to obtain medical records, Section 23A and B of the National Health Act. Rights to decline or refuse treatment, Section 23(1)(d) of National Health Act. Then, and under the Patient's Bill of Rights. Then, rights to terminate service against medical advice, Section 20, Code of Medical Ethics. It is there. Then, rights to transparent billing, Section 11B, Code of Medical Ethics. Then, under the Patient's Bill of Rights. What is transparent billing? It is that, as you recall the scenarios we have given, one of the ways to stop healthcare fraud as it relates to billing is transparent billing. Transparent billing is you inform the patient as his bill is growing, as he's taking treatment. If he has undergone surgery and the surgery is 50,000, and you now give him another treatment which is 10,000, you now tell him that his bill is now 60,000. So you per treatment billing, as the bill is accumulating, the patient is following the bill, so that at the end of the day, when you tell him your bill is 250, the patient is not alarmed. He followed you till the bill got to 250. It is usually when you are treating and you now want to bring the whole bill at the end of the day, that is when they begin to upcode and unbundle bills. So next, rights to privacy, Section 11A, Code of Medical Ethics. This is also under under Patient's Bill of Rights. Then rights to respectful and dignified care, Section 35A and 42 of the 1999 Constitution. 42 is actually freedom from discrimination, but I joined the two together. Then Section 11A, 11E, Code of Medical Ethics, and Patient's Bill of Rights. Right to quality care, Patient's Bill of Rights. Right to visitation, Patient's Bill of Rights. Right to clean, safe, and secure healthcare environment, Patient's Bill of Rights. Right to religious observance, standard minimum guideline for human rights of COVID-19 patients in treatment centers in Nigeria. Right to lay complaints if dissatisfied with treatments, Section 30 of the Patient's Bill of Rights. So we just have like 3 or 4 more slides to go. Redress mechanisms for patient's rights violation. Fina, pay attention here. Is she still here? Okay.
Yes, I'm here.
Any victim of patient's rights violation can seek redress using any or a combination of the following mechanisms. 1, administrative redress. Here, the patient reports to the CMD, the Chief Medical Director of the hospital, following the steps stated under Section 30 of the National Health Act. Now, personally, I do not agree with Section 30 of the National Health Act as to the procedure for laying complaints, because it is funny. I have a complaint to lay, and you are telling me that somebody has to, first of all, approve my complaint before I can lay it. Now, if the commissioner, I am the person that something happened to, and you are now saying that the commissioner for health, we have to approve my complaint, I will have to write to him and follow this. I do not personally agree, but for the purpose of knowledge, you need to know. Let me read it. Section 30. A person may lay complaint about the matter in which he or she was treated at a health establishment and have the complaint investigated. That's 31. 30B. 32. The minister, commissioner, or any other appropriate authority shall establish a procedure for the laying of complaints within the areas of the national health system for which the federal or state ministry is responsible. The procedure for laying complaints shall be displayed by all health establishments in a manner that is visible for any person entering the establishments, and the procedure shall be communicated to users on a regular basis. In the case of private hospital establishments, allow for the laying of complaint of procedure with the head of relevant establishment. It is a long read. It includes provision for acceptance and acknowledgement of every complaint directed to head establishment, whether or not it falls within the jurisdiction or authority of the establishment. Allow for referral of any complaint that is not within the jurisdiction, authority of the health establishment to the appropriate body authority. In laying a complaint, a person shall follow the procedure established by the minister or a commissioner as the case may be. How many of you have gone to hospital and you saw displayed on the wall procedure to lay complaints? I know you will always see, what's their name? Cervicon boxes to say any complaint, put it here or call this number. Now, a phone call, who acknowledges your phone call? Is there any acknowledgement copy of your phone call? So that is where I have issue with the procedure of complaints. For me, the simple procedure would have just been write your complaints, written form, go and submit it, and have let them have a designated personnel to which the complaint is submitted, and let the person acknowledge the complaints, and management will take it up from there. So basically, administrative redress requires that you complain to the management. If they take it up and you are satisfied with their action, it ends there. Sometimes it could be an apology. That is issues that border on medical negligence or on violations of patients' rights. You cannot be reporting medical malpractice leading to death to management. Even if you reported to management, that's why we said you can take one or a combination of the mechanism. If it borders on criminal matter, on criminal offense, you report to the police. Next is professional redress. You file a complaint before the Medical and Dental Council. Their complaint before them comes in affidavit form, meaning you go to court. Here you don't submit letter or petition. You go to court and swear to affidavit of facts. My name is XYZ. I was a patient admitted in so and so hospital. This is my hospital number, or this is my card number. On so and so day, Dr. So and so treated me or attended to me. This is what he did. This. You state facts and you submit it. The Medical and Dental Council will look at it. If there is merit in your case, I have submitted petitions, we have filed petitions before them. So if there is merit before your case, after you file, they will take that your letter, your complaint, and forward it to the doctor you complained against and tell him to respond. The doctor will file his counter affidavit in response to your complaints. Then, when the doctor has responded, they will send the doctor's response to you, the patient, and so that you file a further affidavit to the counter affidavit of the doctor. When all that have happened, they will go through the case. If there is merit in that case against the doctor, then we set up a disciplinary tribunal. That is where you have Medical and Dental Practitioners Disciplinary Tribunal against the particular medical doctor. Then, third one is legal redress. We have done administrative, we have done professional. Legal redress. This is where you go to court. There are two types of legal redress: civil litigation cases that involve financial loss, you go to court. Cases that cost you physical harm, but not permanent, even if it's permanent in nature. For example, somebody's limb, you gave someone an injection, a wrong injection, or you gave the person injection in the wrong place, and it affects his leg that he cannot use it again. Loss of limb, the limb withers. That is permanent damage. So you go to court, and part of your claims will now be damages for loss of earning, compensation for loss of earning. Assuming the person was an Okada rider and was using his leg to select and change gear. Now the leg is withered. For the rest of his life, he cannot walk again or drive his Okada. How will he feed his family? So you make claims, compensation for loss of earnings. Then criminal litigation, we have talked about it. It's involved any criminal conduct, organ harvest, even sexual assault by healthcare professional. That is an abuse of victims, of a patient's rights, and also a criminal offense. So such, you don't just only report to management, you report to the police. 1. 2, issues around organ harvest, because that one is most prevalent now. Then cases leading to death. All this you report to the police. The police will now investigate to know whether there was intention. It was a mistake. If it was intentional, if it was a deliberate act, that is murder. If it was a mistake, that is manslaughter. Whichever one, both of them are criminal offenses. The police will charge the doctor to court. The court will determine his fate based on this thing. What's it called now? Preponderance of evidence. Once the defense is able to establish or introduce doubt in the mind of the court that it was not this person that did this, or that it was not done deliberately, that will reduce the sentence from murder to manslaughter, which is life imprisonment. So that is that for criminal litigation. So we now go to challenges. We've been talking about this. You know, it's interesting, very sweet. We are talking, I have this right. What are the challenges to seeking redress by victims of patients' rights violation? 1, lack of awareness of their rights. You cannot enforce a right you do not know you have. Ignorance of why they should seek redress for violation. Some don't even know why. Some will say, okay, if we go to police, if we go to report, if we take it up, will it bring back the life of the person that has died? So they will say, no need. Just we leave it to God. That's why I was asking, why was nobody praying? We will get to that, religious and cultural inertia. Then, lack of knowledge of where and how to seek legal redress for violation of their rights. We've just discussed that. Cost of seeking redress. It is pretty expensive. Litigation is expensive. Lack of evidence and access to their medical records. We will look at evidence gathering next, and that will be the end. Illiteracy and lack of capacity and poverty. We talked about cost of litigation, cost of seeking redress. Poverty is a major issue. Once a man is poor, he has no rights. He has no rights. Because you can only claim rights that is enforceable. If you can't enforce the right does not exist for you. Lack of evidence and access to their medical records, we've talked about it, illiteracy, poverty, emotional re-traumatization. For some people, going to court brings back the entire picture, the mental torture, the trauma all over again. Then improper evidence gathering and evidence tampering. Some tamper with their evidence. There was a lady, a case of misdiagnosis. She was misdiagnosed of breast cancer, whereas she didn't have breast cancer. So she underwent surgery for breast cancer, and they brought her to National Hospital for continuation of treatment, post-surgery treatment. But she has done a immunochemistry test for them to determine the nature of the medication they'll be given, continuing. Then this result was not coming out for more than 3 months, 5 months, 1 year. And an NGO directed her to me. And I wrote a letter of demand on her behalf to the hospital. Wrote a letter for her on her behalf. I wrote in first person as if she was the one writing. And I said, go and submit this letter to that hospital. We are demanding for them to give you your test results. She now went to submit the letter. But before submitting the letter, she gave the letter I wrote to her uncle. Her uncle now read the letter and said, Kai, this is too harsh. This is too harsh. Just remove here, remove there. Her uncle edited the letter and now gave her nonsense, chaff, because the uncle has removed what would have implicated the doctors. She now went and submitted chaff. That is one way of evidence tampering. And the other ones is the documents you are supposed to keep, you destroy. Other ones, some messages or vital communication, you delete them. You don't have them any longer. Lapse of time, limitation of action. For medical negligence cases, the limitation of action is 3 years, meaning within 3 years of the occurrence of that incident, you must file a suit in court. If you come on the 4th year, you are caught up with lapse of time that will tell you that your case is statute barred, meaning you cannot be heard again. However, there have been arguments as to when does this 3 years start counting. Is it upon the occurrence of the incident or when the patient, when the victim becomes aware of the far-reaching effect of what has happened to him as a result of that? So those are the issues. Cultural/religious inertia and sometimes threat to life. There should be inertia there. Inertia means inaction. Religious inaction. Some culture, some people will take up a case. Next thing, the traditional ruler will call you, say this is a family matter. Let us resolve it. It's a family matter. I think it was on Friday, I saw a gory case on Facebook, a 9-year-old girl that was being violated by her father, her biological father. The mother went and reported the case to police. Then the man's brothers came and said it's a family matter. Let us settle it within the family. And they now started threatening the wife, the woman. That's why I say threat to life in some cases. They started threatening the woman that if anything happens to their son, that's the husband, they will hold her responsible. Next thing, the same woman now say, they should leave her husband. Oh, if they take him to prison now, who will pay house rent? If they take him to prison now, who will pay the school fees of children? Religious inertia. Let us leave it to God. The God giveth, Lord, the Lord giveth, the Lord taketh. That is in the case where somebody has died. Say, leave it to God. The Lord giveth, the Lord taketh. Glory be to his name. It is not the Lord that taketh or that took. It is medical negligence or patient's rights violation that killed the person. So you should seek redress. stigmatization and decriminalization, and discrimination, sorry. You see the recent case of Senator Natasha. She has all the money. She has the political capacity. In fact, yesterday, maybe 2 days ago, I read a woman posted that nothing happened to her. She's lying. She's this, she's chasing cloud. And now imagine where somebody does not have that type of capacity. What the person, so stigmatization, even in medical negligence cases. When you are passing, see, I'm not carry that doctor go court. See them. We don't beg them tired, they no agree. Wicked family. So if they remove the doctor from job now, if they pursue him, waiting the doctor go use feeding family. Stigmatization. Lapses in judicial procedure, undue delay in getting justice. This is a serious matter. Some people will see if I find that one now, still thy kingdom come. 7 years, a matter is still in courts. 10 years, a matter is still in courts. So when the person thinks of this process, say the person, let me just leave it. I'm not doing. So these are a few, there are more. So patience, please. Let me rush the remaining one. Evidence gathering. In the realm of medical negligence, the ability to construct a compelling case hinges on meticulous gathering of evidence. As we navigate the challenging terrain of seeking justice for medical malpractice, understanding the nuances of evidence collection becomes paramount. Why evidence is crucial? In any medical negligence or malpractice case, evidence is the key to proving the breach of duty and resulting harm. Without solid evidence, patients may struggle to prove their cases before a court or disciplinary tribunal. Types of evidence. The medical record is the first evidence you rely on. At the heart of any medical negligence case lies the patient's medical record, a comprehensive narrative of their healthcare journey, from diagnosis to treatment plans, medication prescription, surgical procedures. Medical records serve as the foundation of evidence. Our collective task is to meticulously review these records, seeking discrepancies, omission, or deviations from standard care that may point to medical negligence. Now, for you as a healthcare professional, your duty is to document, proper documentation. That will be the only saving grace. So if you administer the medication and you fail to document, if we are checking your medical record, we will not see it there. So it counts against you. So documentation, you document the action and the time it was taken. Next, expert testimony. In the pursuit of justice, expert opinion stand as pillars of credibility. Engaging medical professionals who specialize in the relevant field can provide invaluable insights. These experts can offer opinions on the standard of care, causation, and the extent of harm caused by medical negligence. Their testimony can significantly bolster the case, providing the court with a nuanced understanding of the health care standards applicable to the situation. Now, in practice, the way it is done in practice, I told you this is practical. In practice, if the doctor you are suing is a consultant cardiologist, you ensure that your witness is a consultant cardiologist. Why? Your witness knows what the doctor knows. If you're suing a gynecologist, your witness should be a gynecologist of the same standing with the defendant. Why? They are in the same professional capacity. Now, if you you are suing a consultant nephrologist, and you went to bring a consultant pediatrician as a witness, your case will fail. Because even though they are both consultants, they are not talking at the same level. During cross-examination, once they keep asking the witness you brought question, firstly, they will just ask him, are you a cardiologist? He says no. Okay, witness, it is true that you are not a consultant cardiologist. He said, no, you are not. It is true that you are a consultant pediatrician. Yes, my lord. That will be the end of the case, because he has no knowledge of the intricacies of cardiology. Is that clear? That's for expert witness. You bring a witness of the same standing with the defendants. This one is practice. You don't get it in textbooks. Next, witness statements. This witness statement could be statement of family members, other patients, or staff who observe the incident. Witness testimonies offer a human perspective to the case. Patients, family members, or even those who attended to the patients, we will get to know the importance of this when we deal with processes of evidence gathering. Their testimonies can offer nuanced details, emotions, and contextual information that may not be evident in the medical records alone. The collective gathering of this narrative enriches the overall tapestry of the evidence. Now, photographs and videos. We are in digital age. Evidence of injury or condition caused by malpractice. If you say this malpractice, okay, one of my relatives had an issue. She was hospitalized. They gave her medication. As a result, her face started swelling up. Her eyes, her face became like 2 times bigger than it was. They called me. I am in Abuja. They are not in Abuja. They called me and say, Uncle, this is what is happening. I said, okay, snap it and send to me. Do a video of it and send to me. She did it. I called the nurse on duty. This is what is happening. They say, yes, sir. It is part of the side effect of the medication. I say, oh yeah, go to the patient and tell her. You didn't tell her. Go and tell the patient that this is a side effect of the medication. Within so and so time, it will normalize. But we have already gotten the evidence. So if we are saying these things got my face swollen and I got discomforted by it, this happened, this is how my face was. The court will see that this face is 3 times bigger than the normal size of a human face. Photographs or videos document injury, surgical procedure, etc., or the aftermath of medical negligence can serve as compelling visual evidence. These visual records provide a tangible presentation of the harm caused, offering a visceral understanding that complements the medical and expert opinion. Next, documentation of communication, establishing accountability. Clear and concise communication is an integral part of medical care. The gathering of evidence should include documentation of communication between healthcare providers, patients, and others involved parties. This can include email, text message, or written correspondences that may reveal crucial information about the decisions made, informed consent processes, and any communication breakdowns that contributed to medical negligence. So if they sent you a message as you're visiting, any documentation you have, keep it. The last one, evidence gathering processes. Number 1, this is our last slide. Personal journaling. When you get to hospital as a patient or a patient's relative, you do personal journaling. What are you journaling? What happened? the date they treated you, the name of the doctor that treated you. Was it morning shift? Was it afternoon shift? Was it night shift? The name of the nurse. 1. 2, if you know the names of the medication that was given to you, fine and good. If you don't know the names of the medication, ask. If they don't tell you, if you had a reaction after taking a particular medication, document what your reaction was, what time did it happen, did you take the medication, and the date. If they have their own record correct, they will show us the name and the name of the medication they gave you and the dosage they gave you. Now, this process, it is not usually shown to the doctor. They are not aware that you are doing personal journaling. Why? Because most times when issues occur, the first thing they do is to doctor their own record. If they have made mistakes, they'll go and clean it up and produce a clean record, doctored. But if you have your journaling to say, this is what happened to me, these are my personal journals, the date, time, at least the date will correspond with their date, the time will correspond with their time. So personal journaling is one. Complex documentation, we've talked about it, medical records. Some people, things we have, before you go to courts to sue, oh God, should I say this? I usually say this when I'm training lawyers. This is not the right place to say it, so I will not say it. Collect documentation. Ensure that medical records and or the correspondence with healthcare providers are collected and preserved. Seek experts' opinion. Now, while you are being treated, even when prescriptions are made, when you go for diagnosis, seek second opinion. When you have gone to hospital A and they diagnose, seek second opinion in hospital B. When you have already commenced treatment in hospital A, when they say things you do not understand, tell them you want to confer with your people. Seek another opinion. Where there is contradiction in the two opinions, it becomes a good evidence for you. 3, witness statement. We have talked about it. Gather statements from anyone who witnessed the incident. Legal consultation, of course. A lawyer, not just a lawyer, a medical lawyer can help you organize the evidence and advise on whether there is case worth pursuing. Some people, now let me also say this, it is not in every case that a patient dies that the hospital is negligent or that the doctor was negligent. No. There are cases that are 50-50, 50-60, 50, 60-40, 70-30. There are cases that everything is going on well. Then all of a sudden the patient dies. In such a situation, you do not hold the doctor liable. But because patients do not know, they say, don't kill our brother. You are not a medical doctor. Now, if you go to Medical and Dental Council, they have one job. Did the doctor follow the procedure? Not did the patient die. If the doctor followed the procedure and if at the end the patient dies, the doctor will be exonerated. It is only when the doctor didn't follow the procedure that the doctor will be held liable. Thank you very much for your patience. Dennis, you now see why I say that this topic should be a sole topic of its own.
Yes, sir.
There are a lot of things I removed because the slide was getting elongated. So let's we make it a single topic. If we had started the time we used to do fraud and this one, we would have finished this one. So this is 2 hours class on its own, please. Thank you. Any questions,
Okay,
please?
Sorry, you said?
I said any questions?
Okay, please, do you have any questions for Mr. Ebenezer?
Yes,
You
I
have
have a
any?
question.
Okay, awesome.
So, sir, good evening. My question dates back goes back to the beginning of the class, and I
Okay.
do not want to interrupt. I wanted you to complete your session before taking you back. So, you said you were trying to differentiate between medical negligence and medical malpractice, right?
Yes.
I didn't get that definition in the beginning because my network was bad. Then that being said, along the line, I noticed some things you mentioned. So when you talked of, I know I heard you say error and mistakes can be
Yes.
classified as medical negligence. Then I know I also heard you say, if I'm correct, that where there is an intention, then that is a
Yes.
malpractice. So
Yes.
in the course of the lecture, you mentioned, I think you were giving an instance as to murder, manslaughter, and then organ harvesting.
Yes.
And then you
Yes.
said that you cannot harvest someone's organ mistakenly. So that is classified
Yes.
as medical malpractice.
Malpractice. Yes.
Now, my question is, this 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 class we just had, were we talking about medical negligence or medical malpractice? Because in the course of trying to understand what you were saying, I was speaking some malpractice, I was speaking negligence. I
I
don't know what was actually going on. I wanted you to finish.
I said that
So that's the question.
people use the words interchangeably. And
Right.
I said that technically, people use medical malpractice as medical negligence as medical malpractice. I was trying to give you people a technical distinction between the two. Some authors will tell you that malpractice is a broader scope of negligence. And I am saying that the distinguishing factor between malpractice and negligence is intention. I did not put in factors, predisposing factors to medical negligence. You did some work around that area. You included it in your work. One of it is fatigue. What leads to fatigue? Sometimes when the doctors are overstretched. We talked about the doctor-patient ratio in our first lecture. Do you get it? Now,
Yes,
that fatigue, tiredness leads to impairment of judgment. It could lead to forgetfulness. At that point, where a doctor has, there was a day I called a doctor friend of mine. He told me he has had 13 surgeries today. Do you get that? So is it the same level of diligence he will use in the first one that he will use in the 13th one? He's human, he's getting tired. So there could be error of forgetting pin, a scalpel in the abdomen, or wire gauze in the abdomen, or a clip. Now, that is negligence. He did not deliberately put it there. But when you are doing kidney, you open the patient up. You have done an anatomy class. You know the organs of the body. You know the human system. Then you now say you mistakenly cut off the person's kidney. It is not a mistake. It is deliberate. And when you have made a mistake, did you inform the person? You did not. So organ harvest is a huge market. So that's why we said if it is done intentional, one of the principles of medical profession, if you remember our ethics class, is the principle of do no harm, non-malfeasance. So when you now deliberately do harm to a patient, it becomes malpractice. Negligence is mistake, inadvertence, error, omission. We all make mistakes. But when you now do it deliberately, it has crossed the borderline of negligence to malpractice. Then on issue of murder and manslaughter, These are basically criminal offenses, whether murder or manslaughter. The only difference is in their punishment. Now, in proving murder, we must establish intention that he deliberately did this thing. So where you give excess overdose of a particular medication, knowing that the consequence, it will shut down the system of the patient in 3 minutes, the doctor will be liable for murder because you know the consequence. Except where you now prove and tell us that it was an error. It was an error. You didn't know that you have taken this dosage, or you wanted to give a particular medication, you gave another one. We talked about similarity and closeness in names. Time didn't permit me to give all that. I can add another 20 slides on this work. In fact, if you check my reference, part of the document, in fact, the book I reference in the second reference is a book I worked on in 2016 when I was with an NGO. I did the book, but because it's for an organization, so it's coming out in the name of the organization, Center for the Right to Health. The book is online. Just Google it. The Right to Health and Violations of Patients' Rights in Nigeria, including this topic, the name I gave it, a Dex review. You will see my name, Ebenezer, where you see it there written as a assistant, associate editor and researcher. You will see it there. Promoting the next slide I had, the third reference is a presentation I did when I trained the students of FCT School of Nursing in 2021, promoting patients' rights and safety and tackling medical negligence in Nigeria, the role of nurses and midwives. So I just picked a few things from that slide, from those work. I can add 10 more slides on this, or 20 more, so that we get detailed explanation. That's why I say that this particular topic is core. So while I appreciate your question, I hope you understand my answer to the difference. We are talking about it. It's just like the difference between manslaughter and murder. It's intention, intent. Did he do it? Is it a premeditated act? Did he plan to kill this man? Did he do this thing knowing that the consequence will be death? That is it. Or was it a mistake? Was it an accident? If it was an accident, it falls into manslaughter. But if it was intentional or premeditated act, it falls into murder. If someone takes 3 days to sharpen knife, and so, okay, let's say you fought with somebody today, 3 days later, the person sharpens knife and comes back with the knife to fight you. And in the course of fighting, he brought out the knife. Another person comes to separate. He uses the sharp knife on the person, on his neck, not on the leg, not on the hand. And the person dies, you say it's not murder. So medical negligence and medical malpractice, the thin line between them is very, very thin. That if you are not technically and professionally involved, you will be carried away. So what we treated is medical negligence, but the topic came as medical malpractice. That was why I took time to explain the difference for you to understand. Check even our law reports, check our legal cases, check your law pavilion, type medical negligence, type medical malpractice, and see the one that cases we throw up. Check your thoughts of negligence. So medical negligence is the mistake, inadvertence. You didn't intend to. But even for manslaughter, or murder. That's why I said that it is not in all cases a patient dies. That explanation is important. It is not in all cases a patient dies that the doctor is said to be negligent. Once the doctor has followed due process and eventually the patient dies, the doctor will not be held liable for either murder or manslaughter at medical and dental council, not in courts. When you now take the case to court, it is for you to prove beyond reasonable doubt that this was a case of murder. This was a case of manslaughter. It is now left for the doctor to prove that it was neither murder or manslaughter, that the death was of natural cause. If that is established, the doctor will be vindicated. Does my explanation make sense to you? Hello, Tari. If you do not understand, you can call me after this class. Let us release other people so that we explain further, even though I am already 15 minutes late for another class that I myself, I am a student inside that one. Okay, so any other question before we go?
Okay, sir. Good evening, sir.
Good evening.
Thank you so much for your in-depth knowledge and explanation on this class. I mean, I've learned so much, and I believe I will do well in this practice. All right, sir. Please, I want to find out, how do you determine when a doctor commits a manslaughter or a murder? Because in most cases, the family of this patient may not be in the surgical lab with the
Yes.
patient. You understand?
Yes.
So what
Yes.
are the variations by which the court use in determining that this is a gross negligence, an actus reus of the medical practitioner? Yes, sir.
Okay. Now, it is always advisable to first of all file your petition before the Medical and Dental Council. It is always advisable by professional experience to pursue your case before the Medical and Dental Council first and secure a conviction there. Once you have gone before the Medical and Dental Council and they establish that the doctor was guilty of murder, you now take up a criminal charge. And in doing that, all you need to do is to attach the verdict of the tribunal to your case. The same thing, even in civil litigation. It is always better to commence before the council, except where there is a delay and you are running out of time. Because remember, your limitation of action is 3 years. If you are running out of time, then you can now file a process in court. But there's always room for amendments. Now, how do you determine that? The record of the hospital we speak. That's why we talked about evidence gathering. Nobody has asked the question I'm expecting actually. That's why we talked about evidence gathering. 1. 2 is that we also talked about expert witness. We said the type of expert witness you are bringing should be a witness in the same standing with the defendants, such that when the defendant says A, thank God you are a lawyer. When the defendant, because the defendant will also put his witness statement on oath now, when he put his witness statement on oath, your witness will, in his own witness statement on oath, put and counter what the defendant has said, stating what the proper procedure is. So once the court is convinced based on evidence, don't forget the court deals with evidence, not with emotion. That is why evidence gathering is important, and the quality of your evidence. So once the court has sufficient evidence before it to ground the conviction, the court will ground the conviction. So, but you must establish, of course, the mental elements. That's the difference between murder and manslaughter. Both of them are deaths. So the only disparity is the punishment. If it is murder, mental elements, it was done with intent. That's why I gave example of overdose. If the dose is supposed to be 1 milligram or 2 milligram, and you will now administer 5 milligram, that is also where autopsy comes in, forensic. If the person is supposed to be injected with 2 milligram and the doctor administered 5 milligram, and during autopsy, it is discovered that there is excess of this medication in the system, and that is what led to his death. It's a case of Rev. Sister Loquito. The fact speaks for itself. That is one of the defenses, though, for medical negligence. There was no time. So this is a topic of its own. We didn't go into defenses. There's contributory negligence. And
Okay, sir, thank you so much. Please, I have a follow-up question to that. Sir, in a case where, because I know that practically the medical profession always advise that whenever there is going to be a surgical operation, the doctor must not be the only person in the lab, right? Definitely, he must be with other practitioners, and particularly another doctor.
It depends on the nature of the surgery.
Okay, sir.
Depends on the surgery. It depends on the capacity of the hospital. But there's always a team. So there is somehow only one doctor will do the entire surgery. But unfortunately, you talk in some private hospital that will be the case. So ask your question.
Okay, sir. I want to make particular reference to my brother, my third brother, and this was in 2013, who went for a surgical operation of appendix, and mistakenly the doctor forgot a particular item in his one of his tools in his tummy, which led to another incident. Now, when we wanted to file an action, we were advised to go to the medical council to report the case. On getting there, we noticed that this doctor is like, when you say a doctor is a politician at the same time, so it's like he had the entire Akwa Ibom state under his, at his care and all. In that case, because we could not get the justice, we had to even go for another operation for my brother. And I think I was still in secondary school at the time, as much as I could remember. Yes, I was still in secondary school at the time. So we had to go for another operation in order for the doctor to be able to remove the tool. It was a surgical scissors. Yes, he forgot in my brother's tummy. We had to go for another operation, and every effort we tried, thank God for the help of Gospel Akpabio at the time. Thank God for the help of Gospel Akpabio, because we noticed that the doctor was too powerful in the state. You don't think that this is one of the limitations that may hinder, a complainant where a case like this occurs, and a complainant will have to go to the medical association, and in that case, the doctor there is already.
Questions.
Okay, sir.
I've understood your question. What efforts did you make specifically? Which lawyer did you engage?
Well, at the time, it was my mom that actually took up the case.
That's the problem. We talked about ignorance. Do you get it? We talked about ignorance. So you people didn't know what to do. You didn't know how to go about your case. Your mom was not a professional. What she was supposed to do, the least she could have done was to engage a doctor, to engage a lawyer. I would have said to engage a medical law expert. But the least you people could have done is to engage a lawyer. It is the lawyer that knows how to go about the case. It's the lawyer that knows how to make the complaint. Once a lawyer, the doctor was not really that powerful. The doctor was doing what he was doing because there was no lawyer involved. If there was a lawyer, an experienced lawyer, the lawyer knows what button to press, and the doctor will come begging and be talking about settlement out of court and be talking about footing the bill of the corrective surgery. Do you get it?
Yes, sir. Yes,
This
sir.
painful, but that is the truth. You people did not do the right thing. We see those cases every day. I told you people a case of somebody, I personally wrote a letter, and she went to give her uncle to edit, and she submitted nonsense to the hospital. Up to today, nothing has happened to that case, to the best of my knowledge. Do you get it? There was a lady, 2023, yes, a lady, November 2023, it was all over, particularly those in Abuja might be aware. A lady was pushed out of a moving vehicle by one chance people. She was rushed to Maitama Hospital in Abuja. And it was all over the news. They rejected her. She died. The hospital in their defense says she was brought in dead. The relative, the professional body of the lady, think these human resource people, human resource management, someone reached them, gave them my number, they called. I told them what to do, the step we should take. They said, no, they don't want it that way. This is how they want it. Let us engage Mr. Macaroni. Let us talk to AIT. Let us talk to Human Rights Radio. They wanted sensationalization. They wanted media trial. I told them these are the steps to take. They were delaying. The next thing, minister set up a committee of inquiry. And I told them, a government office cannot indict another. The hospital is a government hospital. And after sitting, reports came that the lady was brought in dead. They didn't do all it. In fact, they added me to a WhatsApp group of over 400 and something people. I told them this is the step to take. I explained. Next thing, that 2 lawyers have volunteered to take the matter pro bono. I say no problem. Let them go ahead. Later they say, okay, I should come and talk, but I shouldn't mention money that people are willing to contribute money. But I say no, I will mention money. I am a professional here. You don't determine my fee for me. So now nothing has come out of that case. They will say they did their best, but their best was not good enough. So please, when anything happens, the first port of call, look for a professional in that field. If your car has an issue, look for a mechanic. If your body health has an issue, look for a doctor. A specialty in that area. If your eyes have an issue, don't look for a cardiologist. Look for an ophthalmologist. Or an optician or anybody that has to do with eye first. So, I'm sorry about your brother's case, but he's okay now, right?
Yes, sir. He's okay. He's much okay. It's
So
much okay. When we noticed the incident, we had to rush him to another hospital because the tummy was continuously growing.
So you have seen You have seen the mistake you people made. Your mistake was not knowing how to
tackle the matter or the
not
right.
where to. Your
Yes.
mother went to the right place
Okay.
and dental council, you said, but she didn't know how. So what you would have done was to engage a professional. Full stop.
Okay, sir.
I think we should round up the class. I'm missing my own class.
Thank you so
But
much, sir.
let me take it. That should be the last question, and we go for today. The conversation continues on the platform. You people
So I
are
have
not
a
engaging.
question.
Okay. Fire.
Okay, so is relating to this story you just gave now. I thought initially you said something about how a doctor can refuse to like accept a patient. The only time when you
Yes.
cannot stop it when you've already taken the patient and then you stop halfway. That's not allowed. So if
Yes.
let's say they brought in the young lady, even while she was still alive and the hospital refused her, did they do was it like out of their way? Like could they not have done something like that?
Okay, beautiful question. You people are intelligent in this class. Now, let me distinguish between the two scenarios I painted. Section 20 of the National Health Act, Section 20 of the National Health Act says that hospitals should not deny patients treatment in emergency situation for any reason. That is Section 20. That any hospital 21, 20 to 20 subsection 2 says that any hospital found liable we pay a fine of 100,000, or the doctor or healthcare professional we go to jail for a term not surpassing 6 months, not exceeding 6 months. Now, that is hospital, not doctor. Do you get the distinction?
Yes.
The example I made was where, as a doctor, you are on the road and something happened and you volunteer to start treating. We are saying that once you have taken up treatment, you must treat according to standard. That is in your individual capacity. You are at environment and something happens and you identify yourself as a doctor and you take up treatment. You should treat as to standard. But where a patient is brought to hospital, hospital is a place designated for treating patients. Our law says that the hospital or the healthcare professionals in that hospital have no right to decline treatment if such treatment is emergency. Do you get the distinction?
Yes.
The lady that was brought to hospital was emergency case. Snake bite is emergency. Dog bite is emergency. Cardiac arrest is emergency. Labor is emergency. Accident is emergency. Do you get it? But where the person walks in and is normal and talks, and after talking, hospitals can decline treatment by referral. Referral is different from dismissal. What we have here are cases where hospitals just reject patients. That is not referral. Even in emergency situation, when a patient comes, a hospital can have a valid reason, one of which is that they do not have a personnel that can handle that case. One. Two is that the case, they have said they do not have a personnel that can handle that case. Then they don't have the capacity. So why keep the patient here? You refer the patient to another hospital. So what you do a referral letter and hand over. But before you refer, you have to examine. So you come, you look at the patient, you examine, then you refer and give them letter and say, go to the other hospital. You have rendered medical service because referral is valid service. Do you get it now?
Yes, I do.
Beautiful. So I didn't say that hospitals can decline treatment. I said a medical doctor in his individual capacity outside the hospital environment. I was trying to stress the fact that you will not be excused to say he didn't pay me. I was doing pro bono. I was doing first aid. So the standard I am required to, the standard of skill should reduce in this case. No. Once you have taken up a treatment, you treat according to standard. You are a doctor and you are in the plane and there's an emergency and you say, I am a doctor. Sometimes they will shout, please, is there any doctor on board? And you volunteer. Even the first aid you are doing, you should do it the right way. That's what we are saying. You do not, because you are doing first aid, you now do it anyhow. If the patient dies, you'll be held liable. Thank you very much for your time.
I'm so sorry that I have a question.
God of mercy. I am missing my own class, but fine.
So sorry.
Yeah.
Okay.
But it's
So while I was presenting, right,
yes.
In my research, I noticed that or one of the points I made was that you would, for medical malpractice, you would have to show that the patient actually suffered damage or injury, right?
Yes.
So I want to know if that is the case for medical negligence. What are the elements
It's the
that
same
have
thing.
to be in? Sorry?
It's the same ingredients.
Okay.
Duty of care.
Right.
Breach of duty. Harm and causation. We just understand what I'm saying. Once you remove the mental element, the intention, once this person set out to harm the patient, once the goal of the doctor was to harm the patient, that is malpractice, because it is not consistent with the principles of medical practice. It is against the principle of non-malfeasance. Do no harm. Now you are harming the patient. But where the doctor did not set out to harm the patient, and something goes wrong by mistake, that is negligence. The fact that it is negligence does not mean it is without consequence. I hope that is not where you are mixing it up.
No, sir, I've gotten it clear now.
Beautiful. Thank you.
Thank you, sir.
You're welcome. So if you have more questions, let's engage on the platform, but I will start attending to your questions from say 9 p.m. because as I'm leaving here, I'm already 37 minutes behind schedule in my other class, which we end by 8:30. It is from 7 to 8:30, just 1 hour, 30 minutes. And you people have eaten more than 30 minutes, but it's all good. I'm happy that you people are engaging. I need more of that engagement. That's the only way we can learn together. For group 1, I had actually, okay, people I said they don't disappear again. For group
Sir, please,
1,
are still here.
okay. God will, you were here since morning now. You were here since the beginning. Are you still the same people? Still the same people. Every other person has disappeared. Please try and submit, both groups, try and submit your assignments on time Friday. We will on the group when we will do our next topic. The topic for today, actually, we have not done it. So if tomorrow is convenient for you people, 4 p.m., we can take it tomorrow. So I will need your response to that on the platform. If tomorrow is convenient, 4 p.m. If tomorrow is not, we can take it on. In fact, let's take it on Tuesday, 4 p.m. for the sake of those who are not here now. Dennis, please take notes. Let's take today's topic, the one we are supposed to do today, on Tuesday, 4 p.m., so that we don't have backlog. On Sunday, we take our normal time. Yes, but please, group 1, group 2, try and submit your work on time so that we don't have these challenges. And we'll also try to keep to time. Just that this... Hello? Someone said something?
All right, thank you very much, sir. I think it was a mistake. Speaker was unmuted. So please, thank you so much, sir, for your time. Thank you so much for everything that you shared with us today. I want to encourage our mentees to please try and keep the engagements going. Try and be present in class, and when you are called to carry out a particular task, please respond accordingly. I think we've come to the end of today's session. We will see you on Tuesday. I will drop a notification on the group to indicate that, as well as the tax for the week. Thank you very much once again, Mr. Ebenezer, for your time. Please, everyone, enjoy the rest of your evening and good night.
Good night. I told you to remember we should be taking our pictures at the beginning of the class. You forgot, I forgot to. So on Tuesday, our class picture as soon as we convene the class so that we have more people. Good night, everybody.
Good night,
questions
everyone.
on the plan. Thank you.